full board with us this evening, all in person. We got Rob Nato, Norm Goupel, Dulcie LaPoma, Andrea Folsom, myself, Jim O'Brien, and we're joined by Max Aframe, our student representative. We have Jody Condon, our executive secretary, Superintendent Flynn, and then Michelle Clark is visiting us via Zoom land that we're all going to be able to see and hear, or at least hear you, Michelle. So thanks for joining us.
Hi.
Hi. With that, let's start with Pledge of Allegiance. And Andrew, will you lead us?
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
So we have one set of minutes in our packet from our previous meeting of October 26th. And so I'd ask if there is a motion to approve.
So moved.
Second. Is there any discussion on those? All those in favor?
Aye.
Anybody opposed? Ayes have it. Did we have non-public meeting minutes? We did not.
We did not.
No. All right. So our next item on the agenda is student representative comments. And so Max.
So for student representative comments, I would like to congratulate the first and foremost the girls cross country team on making it to New England. It's quite an accomplishment. Also, the girls soccer team for making a four-peat in D3 soccer, and to the field hockey team for winning their first state championship in a pretty long time. Also, we had a dance, not last week, or 2 weeks ago?
It was the 30th.
30th last week, and that went really well. No COVID cases, so we can all be happy with that. And I think everyone's just excited. People are excited for Thanksgiving break and basketball and hockey and everything coming up. So it's good.
Nice. All right. Thanks, Max. So we have school board comments, and we can start anywhere, but we can start with Rob since he's at the end of the table.
I'm quiet tonight.
All right. Norm?
Sure, I'll just wish congratulations again to the sports teams. I think it was great. I guess people.
Yep.
Oh, so huge congratulations to the sports teams. I think it was great. A lot of fans, a lot of support over the weekend. I think it's a huge shout out, especially to the cross country team. You know, that this is, if I recall, probably the third time, Dan, in what, second time in how many years? Century that we have this team going this far, and I think it's just great. I got to wish Rob success and the ladies yesterday, so I wish them nothing but the best. And just congratulations to the girls again, the soccer team. They did beat my high school, St. Thomas. They put up a good fight, I heard, but I was cheering for the Hawks. So just want to put that on the record.
Not for me. Thank you. No. I got to go on a fourth grade field trip a couple weeks ago, and it was so great to be back at a field trip. We haven't had field trips for over a year, and it just really reminded me of how lucky we are to live in a state where we can go. We went to the Great Bay Sanctuary, learned all sorts of things. The kids did great. The docents did a wonderful job, and it was a great time and really nice to be getting to experience a little more normalcy again. So, great job, fourth grade.
Nice. All right. So we'll move into current business, and we'll start. Actually, if board members would humor me, if we don't mind moving up the Hess contract earlier, if that's okay. I see no objections.
Sure, go for it.
And so we have tonight on the agenda to approve the ratification of the Hess contract. And so I know we've all received copies of the materials, and so I would ask if there's any questions or conversation that we want to have about the contract, that we would go into non-public to have that conversation, and then come out of it, ratify it, and we can explain what's in it. But I would, if anybody has questions that they want to discuss, we can go into non-public.
So I actually had one little thing that we would need to do in non-public question about this.
Okay. Does anybody object to that?
Sorry. Very good.
Okay. And so I'm trying to think what the motion would be.
It should not take.
So I would ask if there is a motion to go into a non-meeting to discuss negotiations.
So moved.
All right, so we'll do a roll call. So Rob?
Yes.
Norm Gupel, yes?
Yep. Yes.
Okay, so we're gonna go into a non-meeting to discuss negotiations in probably about 5 minutes, and we'll
Yeah.
come back out. Okay. And can we use?
We'll use the conference room.
Okay.
Do you need me?
No, I don't think so.
Okay.
Billy court. Great. A lot of climbing. You lose your shoes, put it on.
Well, thank you everybody for bearing with us. So I would ask if there's a motion for the Hopkinton School Board to approve the Hopkinton School District's negotiating team's recommendation to approve the tentatively agreed upon contract with the Hopkinton Education Support Staff as presented. That was a mouthful. Sorry about that.
So moved. Second.
Any discussion? All right, all in favor?
Aye.
Anybody opposed? All right, ayes have it.
Can I just jump in there?
Please do.
I want to thank Nancy and her team through the negotiation process. Me living it the first time here in Hopkinton, your team was outstanding. We had great dialogue, and I also want to thank the board for the support you have for the Hess membership. They are a invaluable piece to our organization, our daily work within the classroom, and more specifically with the students that they work with. So I just want to congratulate both sides of the table on a great contract, and I look forward to doing it again for sure. So thank you. Yeah.
And and we'll talk about what's in the contract in a second, but I also want to extend thanks to Nancy and her team. I thought we had a really good, cordial, and fun negotiation. It worked out really well. And thank Michelle, too, for all her effort to get us the information and the data and everything we needed as part of our team to move us along. So thank you, Michelle. I'm looking at you. You probably don't know that, but that's okay. So I'm going to talk just briefly on what's in the contract, and then invite Andrea and Mike and Michelle to tell me what I screwed up and what I forgot. So we've agreed with Hess for a 2-year contract, and so it'll cover the next 2 years. So starting in July 2022 through 2024, and for everybody, Hess, our educational support staff, and it's 54 employees in the district in total. That covers the office staff, that's the clerical, office and administrative assistants, the food service staff, the student support staff, and the library media assistants. I think that covers everybody. All right, got the thumbs up. And so when we sat down to negotiate, I think for both parties, it was important, but I think for this side of the table, what was really important to us, I think one was to retain and support the Hess employees. Really, we wanted to retain our employees here in the district. We all read the papers and we all understand how challenging the last couple of years have been for everybody involved in education. But also just how hard it is to hire and recruit employees for school districts is not an easy task. And so we have great support staff in our district, and so we feel an obligation to support them and to keep them as part of our district. And part of that is wage fairness and ensuring that we're properly compensating our employees for the work that they do. And then, I think, and I feel very passionate about this, part of that wage fairness also, it's wages, but it's also benefits. And so treating our support staff as we treat, and we want our staff across the district to be treated with fair and affordable health insurance costs. And so coming from our side of the table, those were important for us to move forward with. And so we'll put what's called a frequently asked questions, or an FAQ document on the website, so you guys can dig more into this. But what we put together, as I said again, was a 2-year deal, whereas in year 1 we provide a 3.5% increase to the base, and then in year 2 it's a 3% increase, which we feel is important. And then there's some changes, that might be the right way to say it, some adjustments to the wage scale that were needed because it wasn't all that clear, so we cleaned some things up there. And then I think the other important piece I mentioned with health insurance, and I think it's important to know that there's been a lot of conversations in the district around the sharing of health insurance costs for our teachers. But when we look at the former Hess contract, I think it was out of whack for how, at least I know from myself as a board member, how we had discussions around the teachers and really what the Hess employees were already dealing with. I don't know the right term of art is to use, but they weren't equal. There wasn't anything equal there. So, like as an example, while we covered the cost of an individual, we definitely did not cover the cost of a two-person or a family plan. And I think for the HEA employees, those are costs that the district is covering. And I think, and I'm going to get this, I might get this wrong, but I think we were covering like 50% maybe of the cost of a family plan for Hess employees, which to me isn't equal. And of course, if we want to retain and keep these employees, health insurance is a driving factor. And if we're not even close to what we're doing for our teachers with our support staff, that felt, to me anyway, wrong and something that we needed to adjust. And so we did, and so we are adjusting those where the district is going to pay 90% of the premium and 50% of the deductible for two-person and for family plans for Hess employees, which is a change, but it's the right thing to do. And that begins in year 1, of the contract. So the numbers, so the final cost of what's going to be on the warrant for the town to consider for the CBA is in year 1. With those changes, the cost is going to be $122,888.81. And then in year 2, it's $60,817.61. Again, this information will be available on the website for the community to consider, and then it will be on the ballot or on the warrant in March. And there are some language changes as well that's described in the document that I don't think we have to discuss here tonight. So with that, so that was a mouthful. Andrea, I don't know if you have anything you'd like to say or comment on?
No, I think you got it all right. I think the main thing that I think of when I think about the Hess contract is really we're talking about individuals who support some of our students with the highest needs. So these are the folks who are feeding our children, and these are the folks who are supporting our kids in the classroom every single day. And so I think it's really important to support them. I feel good about this contract, and I feel similar to what Jim said that we tried to do the right thing by our Hess members and employees. We've talked all this year already about how we have spaces that we haven't been able to fill, and it's my hope that by providing a better contract for both the district and Hess members, that we will be able to retain this really vital component of our district.
I think you did a great job.
Okay.
Yeah, you got it all.
Nancy, I don't know. I don't want to put you on the spot. I don't know if you have anything you want to add.
No, I was kind of echo what you, Mike, and you and Andrea said. It was a really efficient and collaborative experience getting into this contract, which is exciting, and we're all happy about that. Yeah, we're very pleased with the agreement, and I do think it will help in all the areas that these people, and the insurance change is huge and a long time. It's been overdue, so we're grateful for that. But yeah, thank you.
Thank you very much. Anything else from the board on this?
It's repetitive, but I think the change in healthcare is so well deserved and the right thing to do. So I echo both sides that was the change that came forward. It's a big help for folks.
I just want to say thank you to Andrew and Jim. Nancy, I'm glad that you guys were able to come to an agreement in this budget process. I think it's really important that we're able to, show this to the community in front. And I just want to say thank you both for working so hard and bringing this to the board. Thank you.
All right. Well, thanks, everyone. Thank you, Nancy, to your team. All right, so we'll move on under current business, and I'm going to turn it over to Mike to start the Safe Learning Plan.
Yeah,
Mike.
so Safe Learning Update. Believe it or not, we're in week 11 of uninterrupted school. So it's been a great readjustment back to I'll call it brick and mortar, so to speak. But students have been doing well, teachers have been doing well, and things have been moving. So just a couple updates out of my office. We began exploring pool testing all the way back in July, believe it or not. We finally crossed that making sure everything was in a line, and in that we sent out that opt-in form, which is purely parents opt-in, as well as I want to reiterate that the state covers the cost for the SASS program, so nothing coming from the district. As of this afternoon at 1 o'clock, we had about 12% opt-in, and it's different per building. So our next steps, that will close, opt-in closes tomorrow night, I believe, and because we have to then schedule with the team on where they're going and how we're doing it. So at any point, we'll reopen the opt-in window each week if anyone wants to opt in at any point, but currently right now it's at about 12%. The next thing is vaccinations have become available for 5 through 12. The key for us is trying to figure out another opportunity to bring a vaccination clinic here. It's challenging. We have a couple leads. We have one with Rite Aid. We have another one which we may be partnering with another district to meet the number threshold. And then actually I just got an email from Nicole saying that we are in discussion with, I'll call it the vaccination van, as she titled it. So the vaccination van looks like towards the end of November we'll be able to get a window and a slot here. So all those are still in process. You can schedule online. The state's directing a lot of families to an online registration to send you to different avenues. So pool testing, vaccination clinic, and those are really the updates out of my office. So I would pass it back to you.
All right.
I have a quick question on the pool testing. So that 12% number is obviously pretty low. So I guess, are there pockets where, like, say, it's much higher in the 3rd grade or the 4th grade where the efficacy at 12% doesn't seem to merit doing it, would be my sense.
So we're gonna. It's a great question, and the data that we're showing is going to be challenging for us, where it might be 1 student in one classroom, 2 students in another classroom. So we're going to evaluate it at the close, which is tomorrow, and then really it's about how many more people may opt in after. So the vendor that we've selected said that typically, and I shared it with you guys, most come in between 3 and 15% to start, and then as things get moving, more tend to opt in. So we want to establish our practices and procedures in the building with the outside vendor, see what the data shows, and then reevaluate it. I would say we'll probably reevaluate it around winter break, because that'll be about 6 weeks, 6 visits for them. So,
Great. Thank you.
Any other questions on what Mike presented?
Do you think at some capacity, once it closes, you can send us a memo of kind of what each location was, if it was higher Harold Martin?
Oh yeah. So the next board meeting, whether that's the 23rd or December, I'll bring you that information and we'll go from there. Yeah.
That's right. We haven't set that date yet.
We haven't.
Good to remind me. I'm
Yes.
glad. All right. If there's nothing else for Mike, we have 2 other topics, but I want to thank Dulcie and Norm for bringing forward a presentation and discussion around our masks and where we are and sort of what the future may hold. And so, Dulcie, I'm going to turn it over to you.
Matt, can we project? Is that cool? Should I talk into the microphone?
That'd be great.
Okay. Oh, do you want me to share my laptop? everybody? Can you hear me? Kosher? All right, what we're hoping to do today is sort of present to the board some work that Norm and I have done over the past several weeks. Going through a general update, sort of where we are with vaccinations, and sort of what those projections look like for kids in the 5 through 12 range now that we're new approved. Looking at how we've done as a school district, and then move forward with a recommendation that is a recommendation for discussion by the board tonight, and can continue to happen. As a general statement, I would like to reiterate that I share the same goal as Mike Flynn, which is I would like to keep all of our kids in school for 180 days this year. And so that's all with the guise of trying to keep kids in school, not trying to go back to remote. We want to all be here together. Really quickly, if you look at the general status, on the left here we have a chart from COVID Act Now that was taken yesterday, but basically it's sorted by population. Merrimack County overall is doing all right. We're at 33.4, I think, cases per 100,000. You're looking at the new cases of COVID in New Hampshire. We are on the up and up. We'll see how this does. If you look at hospitalizations, it roughly tracks to that. Just as a general status update so people sort of know the latest numbers. How we did this fall. So if you look at this, these graphs are cumulative in terms of students. So overall, we haven't done more than 10. All right, so yellow is HMHS, red is Maple Street, yellow is Carroll. This was updated as of yesterday, I think, so there is a little bit of activity today. And same thing with absent and quarantining. So for the most part, there have been some weeks when we've done great, some weeks when there's been sort of other stuff happening. But if you look at data for other school districts, there's not a lot available online, to be clear. But we're doing pretty well given the policy that we have in place, and we should be, I think, pretty pleased with where we are. And that's an editorial statement. But in terms of staff, pretty great, right? Absent quarantining, 0 in terms of what we've seen. Some cases here in the 1 to 2 range at the middle high school. Okay, any questions there? The biggest thing, just to, a lot of this is just snapshots, moment in time, just we're getting a general status update. For Merrimack County overall, 12 plus, we are at 72%. Obviously there's a huge, everyone who's 65%, highly vaccinated. There's still some gaps there. And this number is driven primarily just by kids, right? That's all encompassing of all residents in the state. So this should increase over time now that we have vaccinations for 5 through 12. This will, no matter what, hit a local maximum because we don't have any vaccinations for kids under 5. But we should see this start to edge up. So that's also fairly well. I tried to do some work looking at herd immunity statistics. There isn't a consistent number with Delta, so this is just something we have to be mindful of as we look at where we are, new variants, etc. Real quick, so last week the CDC unanimously recommended the Pfizer COVID-19 vaccine in children ages 5 through 11, so that's, I think, great news for those families who want to vaccinate their kids. We have 37 kids in pre-K. I will say that in my recommendation, I didn't get to the pre-K class. We didn't get to the pre-K class. That is sort of the last outlier of kids who can get vaccinated. So I think there's a discussion there for those kids. Otherwise, we have 499 kids in K through 7. We didn't have age-wise data, but it's a pretty good chunk of kids who should be opening up the vaccinations, and it'll be sort of interesting. The big things to think about for rollout are obviously availability. I think all the articles today, all the articles for the last several weeks have said that there's widespread availability of pediatric vaccines for kids. When I did check at the Hall Street CVS yesterday morning, it looked like it was sort of booked up, but those appointments are rolling daily. So generally, people should call their pediatrician. I think DHMS is going to have them, Dermot Hitchcock is going to have them the next week or two. Rite Aid, Walgreens, CVS, all have them and have sort of rolling availability. Kids are required to have 3 weeks between sort of move on vaccines immediately can do that. Then this week they can sort of sign up to get their first shot for their kids 5 through 11, which means that we would like to move to mask recommended at some point in January. If we get differing guidance from CDC, DHHS, AAP, then we can go ahead and consider that. But like assuming that's sort of where we are right now. If there's a drop to moderate levels of community transmission, right now if you look at the differences between the CDC and New Hampshire, we're sort of in that substantial to very high rate, and I'm happy to talk through that. If we have consistent availability of vaccines and ongoing pooled testing. So I think that one of the biggest things here is we want to make sure that for all families who do want to vaccinate, have the ability to vaccinate their kids. If things get clogged up, there's no vaccines available, then this might change this sort of window. If there's a huge surge, when we come out of Christmas and it's like severe and guidance everywhere saying to keep masks on, then I think we want to sort of know that, right? But overall, I think if we're able to keep community transition consistent around where it is now, people are able to vaccinate their kids, you know, we are able to sort of think about making that move to mask recommended for kids 5 and up. This is with the caveat though, the mask will become mandatory again for 10 and 14 days. If, again, we move to sort of severe or very high levels of community transmission. So, and that's primarily because the schools are a piece of the broader public health picture. Hopefully that will not happen. We have seen that with vaccination rates, community transmission should be going down, but again, we'll sort of see how these numbers look. There are cluster outbreaks in classrooms or in schools, so if we start to see hot pockets of things happening, or there's a shortage in vaccine availability. Questions?
I just want to comment. I just want to say thank you to Delcy. Working on this with her was great. There was a lot of work back and forth with our schedule and stuff, but you know, I think one of the most important things is this board asked for some type of recommendation or plan of, you know, what we've been working on. Of course, that changed significantly just last week, where we were working on something and it changed completely with vaccination changed. And, you know, we are putting together something that we are trying to submit to the board saying, you know, now vaccinations available for kids, which is a parent's choice. And that's their choice for a vaccination, we understand that. But hoping that it's available for all our students, for our community, you know, and being able to maintain, you know, low community transmission, keep it well. But I just want to say thank you to Delcy. You know, putting something together like this was a lot of work, and I want to really tell the board thank you for our help on this. So.
Questions for Dawson? I guess I have one.
Yeah.
So help me understand, like, the evaluating the following. Like, how do you think about those 4 bullet points, I guess? And
So I think for me, and again, this is a really important thing.
yeah.
I think it's number 1, if there's consistent availability, that is a major driving factor, because we want all of the families who wish to be vaccinated to feel comfortable with their kids being in a mask recommended optional environment, whatever you want to do, have the ability to do that. And so I think that being able to, like, people look at that. I think that having clinics will help. I think that just, like, keeping our ears open if we're hearing stories of, I can't get an appointment for my kids, then we sort of have to, like, really think about that. I think if there is a major change in the levels of community transmission, I think that's really something for consideration, because while
we are here for the schools, or I think there is still a component of the fact that this is a place where kids are vectors and they're a big part of this community, and we want to just keep an eye on that because we want to keep just the pulse of everyone there, and we want to try to keep those schools open 180 days. And it was likely, not for sure, but that if community transmission increases significantly, then we will start to see sort of localized clusters in the schools. So that's sort of like a couple piece of that. CDC comes out 3 weeks and is like, woohoo, we feel comfortable with pediatric vaccines, and I think that we can and should evaluate that immediately as a board, and that's something that we can go ahead and think about. But right now, all of those levels of guidance are saying that with substantial community transmission, we're still at mass recommended. There was an article with the state epidemiologist today saying that now that we're going into viral season, we want to keep, kids are not through vaccinations yet. We want to stay consistent until we're sort of over the other side of that. And I just think that pool testing is great for peace of mind, but that's like, we're at 12%, you know, it's just, we shouldn't be defining a metric for that, nor can we. Does that make sense?
Yeah, that's all.
You know, it could be potentially that, you know, if we do go down to January where it's mask recommended, we may see an increase potentially in pool testing, or maybe people will opt in more as a measure for their own selves. You know, like even though their child's vaccinated or maybe they're not vaccinated, that could be an option of, you know, them reevaluating their safe learning environment for their child. Because to me, again, keeping our children in school 180 days is the goal. This is directed towards all students, not just 1 or 2. It's everyone to try and get there.
And I think the last thing to reiterate is that everyone can continue to send their kids to school with masks if they want to, right? Like, every family should do what's right for them, and I think the biggest thing for us is trying to think about
Looking at it, so you can wait for me to find.
In January, we have January 11th, January 25th.
Yeah. So we want to shoot for the 11th as a date in order to put this on the agenda to talk about?
I think, so that gets us to 8 days after school, I think resumes regularly on January 3rd.
Yep.
So that gets us to 8 days after. I think my recommendation would be have the discussion then and be able to look at numbers. We should be able to have a pretty good sample size coming out of the holiday of where we're at. And then it's whether or not we feel like it's good for that week following and our week after that. Hopefully, right? Like there's a lot of stuff where we're building the train as we are putting it on the tracks. To see like with the index of where we are, because there are factors that are going to change with people being inside more respiratory, you know, like there's just going to be stuff that's going to happen. So, yep. All right.
So then Rob might finish. Norm, do you have any issues with that happening on the 11th?
No, I think it's great. You know, I think a lot of people, you know, have said, you know, they'd like to see, you know, something not kicked down the road, but an end in sight. You know, and I appreciate that we have something for this community to see. You know, some people within the community have said, you know, what happens when we do remove masks? How are we going to educate our kids if there is an outbreak? And I don't know.
Yeah, so can I say one more thing about that?
Please.
Yeah.
So I think we don't have these numbers right now, right? So like how we're defining a cluster outbreak will have to be a definition that we have that's clear for everyone.
Yeah.
I think we can work on that. There's ongoing guidance coming from friendly districts and what we've been looking at to see like sort of what does it look like when people are defining that based on the size of the district. And those are continuing to be numbers that we can put together because I think we want to know, with the goal of keeping people in school, like what does it look like to make the shift back to masks on for that period of time, and hopefully get it so we can keep kids in school.
And if how we can educate kids if there is some way that they can't attend school and it's this, how do we meet the needs of those students? You know, we need to find that path consistently if that happens. So.
And I think we already do, since we do have tutors for kids who are.
Correct, but there's a difference when you take the mask off potentially. We don't know, so I think it's important. You know.
So I had one other question. We've talked a lot about kids and kids being masked and not masked in school, but we also have 150 to 200 adults who are also currently operating under the universal masking. So how does this impact our teachers and staff?
Great question. I think my assumption was that it sort of moves in lockstep, because I'm still of the opinion where faculty should always feel like they can wear masks if they want to, and I think that should be fine, and I think that's not my, yeah. But I think that if we're seeing outbreaks, then if the kids go back to wearing masks, then I think the teachers should go back to wearing masks. I think that is just much easier for modeling, being able to understand, like, you're just setting a precedent for the kids. And I think that is a unit that's together. It's effectively a cohort. And so the cohort has to move together.
It also goes with now the vaccination's out for kids. If you have a teacher not wearing a mask and you have a student that's not unvaccinated, you're looking at something that could potentially happen. Because there's teachers at all 3 locations. So I agree with her. It does go hand in hand. Rolling it back at the same time. It just helps, I think, with a lot of keeping things in a better place.
Yep.
Any other questions or thoughts?
I guess my only question on the teacher front would be if you're in a meeting in a space that allows for distancing, people have been vaccinated, and no students present, is that something we're open to? Or if teachers felt comfortable doing that in that circumstance?
I'm sorry. I was also thinking like custodians. I mean, we have staff who aren't always around people like during the crush of day school and that. Anyway.
Yeah, I think that those are like the outlier cases that we can, like, as we work up to that date, like, I think there's definitely some ongoing, like, detailed guidance that needs to be provided, and I think that's something we can talk about. Yeah.
Well, thank you. Yep, that's great. And so we'll have it on the agenda on the 11th.
Yeah.
We'll revisit it. Thank you. So the last item under the Safe Learning Plan is to talk about fall sports. And so
Winter sports.
Did I say fall?
Yep.
No. Going backwards. Winter sports. So we had, Chris came 2 weeks ago and presented sort of the recommendations from Dan and Chris on winter sports, not fall sports, and specifically indoor winter sports, even to get more specific. And so boil it down to sort of the 3 components of the recommendation. The first one was around fans, and it was to allow for 4 tickets per player for fans to be able to be present, is probably the right way to say it, to be present in the gym for the basketball games. And then the second one is that masks would be on everybody. So that would be masks on spectators and masks on players, except for the third piece, which would be those on players on the court would not be required to wear masks. So those are the 3 pieces of the recommendation that came forward from Dan and Chris. And so I thought our conversation could start there, sort of on the recommendation, and we can see how we feel as a group moving forward. And so I figured maybe we can take those 3 and sort of sequence them. And so start with maybe start with, maybe it's not the easiest, but we could start with one. Anyway, start with the sort of the tickets, the sort of ticketing system for how spectators would come to the games and see how we feel about that. And so I don't have a way to do this other than to frame it up and then hunt it over to you guys to sort of, give reactions, and we could sort of go from there.
So I punted it back to you, understood.
Any thoughts on this?
I'll go first on the tickets. So we have held numerous events in the gym since the pandemic. We've held award ceremonies for our students where it was a substantial amount of kids in there. And I personally feel that we've done a dance, we've done other things, and we've been able to have a safe environment. I think it's a lot different than it was. You gotta speak out. Okay.
Just keep it on going.
Keep going. Okay, so I support allowing tickets for mass fans for these games. I think that we've been able to use it outside of sports for academic reasons. Like I said, we did it for award ceremonies, we did it for other things, and I think we're in a better situation now where we can do that. My question would be, is this including visitors? Is my question.
Well, hang on.
Yeah.
Is that different?
Yeah,
Okay, so to you, so is this including visitors, or is it just strictly we're talking for fans for students?
Yeah, so since the last board meeting, I'll compliment Dan and your surrounding athletic directors. They put a really good sheet together in regards to what everyone's doing. Right. So a lot of times you guys ask me, well, what's everyone doing? So currently the majority of the teams in the league are requiring masks, but not limiting who can come. So there's no limit on how many. It's not limiting who. I'd say there's one quirky one in here that says visiting fans will sit behind visiting bench. I mean, to me that's a little quirky, but the majority of people in our league are all fans in masks, no limit on that. So I'd say that's where we stand on that piece of information.
And I'd actually be really comfortable with that, actually not doing a ticketing system, just having fans, just as many as feel comfortable attending.
And that's generally where I am as well. And there's a couple of reasons. I think the first one is students like to go to basketball games, and I think that's a given fact. And so if they can't secure a ticket from another player, I think in many ways it would be restricting students from attending home games. And just hearing what Mike just laid out, our students would be able to go to away games and see all the games, but they couldn't actually go to a home. It would be harder for them. They can't say they wouldn't go, but it's harder for them to get to a home game, and that feels it feels like we're restricting attendance when they're in school with each other all day in masks. And so I think if everybody wore masks, if that was the requirement, I feel like why would we start to put limits on individuals going into the gym? That's just me, so that's where I would come in. So I wouldn't want to see a ticketing system. I think if we wanted to put restrictions on the number of people in the gym, I would say that's okay. We should do it on a first come, first served basis and allow for students, families to get a ticket if we wanted to put restrictions on. But I feel funny saying, hey, the 12 kids on the basketball team, here's 4 tickets, distribute, as you will, and then not allow so everybody who might want to go.
I guess my only question, would be when we require masks and perhaps for visitors, somebody's going to have to enforce that, and how are we going to plan for that? The game director's job is not to be, for lack of a better word, law enforcement. So just keeping that in mind in the array of opinions on this, are we prepared for that, and do we want to set that environment up? Do we start the season with home fans only, or do we simply have a plan in place where there is a person who's going to, that is their task?
Yeah, so we would execute on whatever the will of the board is. I feel confident in delivering on, if mask was a requirement, I'm following through on that. I don't want to call it the mask police, but I think I've been to several events, more specifically with our kids, and I think everyone has been respectful I'll say we leaned on the same thing at the start of school, right? We thought it was going to be all this commotion, all that, and it really wasn't. So making announcements before the game starts, during the game, reminders, those things can certainly come into play, but I don't anticipate it being a widespread problem.
My only thought on this is that if we go to severe, like I think if numbers get really, really bad, then I think that we should be able to if we're letting everyone go to the games with masks, no attendance limit.
Yep.
Right. But I think that if numbers take a severe turn for the worse and we're at like over 75, we could set whatever the number is in the stand, that we have the ability to just like look at that to make sure, because I think that we want the kids to be there. We want it to not be a super spreader event.
Yeah, so it's the same as the dance, right?
Yeah.
We evaluated after the dance. We were looking at, Ms. Cook was looking very specifically.
Yeah.
Also, the other things that have occurred, we don't want the season to come down because of that.
Right.
So if at any point that we identified that there was that area, we would make sure that we reevaluated it as a team to make sure the season continued.
And I think it's just like then we drop some of the numbers and maybe it's for a per ticket or whatever that looks like. But I think it's just we want to stay cognizant of changing conditions, and I think that that's okay.
Yep.
And this would be for Hopkinton district events like basketball, correct? No sub things or anything, correct?
So if we're specifically talking about athletic seasons right now, so this would be about athletic events, yes.
Hopkinton High School
Hopkinton
athletic.
High School.
Hopkinton High
Middle
School, okay.
athletic events.
Okay.
We're setting parameters for essentially basketball.
Yeah, let's do basketball. We might have a conversation about hockey.
Hockey.
Because
Yeah, so this is just basketball.
Let's stick with our mindset right now being basketball.
Okay.
Because it's our facility too,
Yeah.
right?
Yeah, yeah.
So whatever NEC has in place, we'll have to follow NEC's protocols.
Yeah.
And if they're trying to have their season, they may have stricter protocols in place.
Yeah.
And I believe they might. I don't want to speak out.
All right, so I'm just trying to read the table. So it sounds like we're going to not do individual tickets for athletes. We're going to allow visitors, spectators to come. Not put a cap on it for now, other than the fire code, which I know is a cap that we respect. And then we will have a requirement of masks on attendees. Is that everybody's understanding?
These are just for high school games and for Maple Street games. That were for high school games.
Just high school.
Just high school.
Middle-
Okay. Just
middle
high
high
school.
school.
Middle high
Just,
school.
Just Hopkinton.
games.
just high school. Okay.
HHS,
All right.
that
Okay.
is under our.
Just want to make sure it's under our umbrella. Okay.
Yeah.
All right.
And subject to change with.
Yeah,
the
continue
ball-
evaluation.
Yeah.
Great,
Yeah.
thank you.
All right.
Okay, so the next piece, which we sort of just talked about just reiterate. So the second piece of the plan was masks on all players and fans. And that would be on the bench when they're not playing. So which sounds like an easy one because that's what we can talk about, masks on everybody. So I see nods. So I don't think we have to revisit that one. And then the third piece was masks optional on players on the court.
Yep. I can tell you where. So I've been going back and forth in my head on this for, can you hear me okay? Great. For the last couple weeks. And it really comes down to whether or not we want to get them through to Christmas when, again, if there's going to be inter-school families that are out there, like if there's a kid on the basketball team who has siblings who aren't fully vaccinated yet, do we want to let them ask them to play with masks until we're through that Christmas break, or do we just, because they're 12 plus, let them go when they're on the court? I think that I'm sort of on the latter. I would be totally fine asking for players to sort of stay masked even on the court until January. But I also understand that there's a lot of districts who, almost all of them, I think there was only one that I saw.
Just one.
Just one.
Yep.
That is no masks on players on the court. So I don't know the size of all the other, whatever, but I think that, it's a relatively small number. Parents can ask if they're uncomfortable, their players wear a mask if they want to. Students, I think, can wear a mask. I don't know what it's like these days,
Well,
so.
Mac, do you want to
Yeah.
weigh in, Max?
I mean, from, I guess, a athlete's or a basketball player's perspective, I mean, I personally would not love wearing a mask on the court. I mean, I understand that was the rules, but if I had it my way, I would go with what has been laid out with you can wear them on the side. You have to wear them on the sidelines, optional on the court. I think that would be the best case scenario for us.
Yeah.
I think it keeps everyone the safest while also allowing players to have their, I guess, maximum abilities on the court, not being restricted by having a wet mask or anything like that. So
Yeah. Yeah, so, yeah.
Other thoughts?
I want to hear from you guys. I
Yeah,
want to hear from
we want to
everyone.
hear from you because you're always throwing it at us.
I can, do you specifically want to hear from me?
No, I'm just listening.
I mean, I would fully be mask optional on the court. I think these kids have had the opportunity to be vaccinated since the spring. Oftentimes, and what we learned last year is that oftentimes the masks are like this, which is not, fully covering anyhow, and just seems like more of a hindrance. And so I think 5 kids on each side, unmasked, I would feel comfortable allowing, handing that over to families to decide what they would like to do and what they're most comfortable with. Yeah, I just don't think that 5 kids on the court are going to be the thing that causes something catastrophic. I think we can also look at the information that we have from last year when this was happening, or look to other schools, or look to AAU that's been played, and we just have not seen outbreaks. So
Yeah.
that's where I fall wrong.
Yeah, so
Thank you.
I mean, I'm totally for mask optional for players on the court. For a bunch of reasons. I think Andrea explained a lot. I also think our team is going to be traveling, and what we're seeing is most, if not all, of our competition are not going to have mask required. So we're going to go as visitors to a bunch of gyms where we're putting the masks on to protect the other players. The other players have chosen that that's not something that they're overly concerned about because they're not going to wear masks. And so it feels at that point like we have the mask for optics and not really for protection, because the other teams generally, that's not the choice they're making. We can choose to do it, but in terms of protection overall, it's not really providing any. And I think to Andrew's point, we have 5 people on court playing basketball, and in terms of like overall risk, that doesn't feel like a very large risk to our community. For individuals, like we just heard the presentation about vaccinations, and these individuals who are on the court have had the opportunity to be vaccinated for many, many months. So I feel very comfortable. I feel very comfortable with the players on the court not having masks. So.
Yeah, the only other 2 things that I would put in there just to have be part of the discussion is I think it's also, I think it's important that all the kids are treated, I think, the same way. I think that's part of it, but I think also for the games, we're looking at 2 games, I think, before the Christmas break, if I'm correct. So that's that. The other part of it, I think, is that I had a really good thought, but it's gone. I know, sorry, it's been a long day.
I'm sorry, go ahead.
Yeah, I think that's just the biggest thing, and I think that, the last thing was that I would really hope that all of the players are really good about self-policing if they do not feel well. There's a fever, there are symptoms, I think Mr. Reserve has been really good about reiterating that with your emails, and I would hope that that is still the case, especially in this environment.
I think our teams and coaches have done a phenomenal job of that.
Yeah. Yeah.
With our fall sports, we had cases here and there, but student athletes were phenomenal at going to see Mrs. Cook at the drop, and that's the benefit of that program, right? So the SASS program allows us to test the students
Right.
on property. So
Yep.
at any symptom, they all felt comfortable to go see Ms. Cook, and we were able to do that. So same thing through winter school.
Yep.
On a season, those are things they have to pay attention to, because if there's cases on the team, that's going to impact how the team can play and who they can play. So I think to your point, it's a good one to keep reiterating, because it's
Yeah.
not just the one individual, but it's the team that's going to suffer.
Yep.
I got a long list.
Well, it's
As
yours.
usual, chart. So, I thought about this a lot, and probably, I think somebody asked me, where are you at? And I was like, I'm not sure. But, the goal was back in August, keeping schools open. So keeping that in the forefront of my mind. But then thinking about, is the K-12 spread concern, is it there? Is that a real consideration in having those families across all three schools? On the other side, as you said, Andrea, I watched last season, and sometimes the masks are here, and sometimes they're here, and they're all over the map. So, I'm not sure how effective it is during a game. We did talk a lot about ventilation last year, and one of the points that was brought to me was in that gym with our current ventilation system, it is very akin to being outside. So it's not really all that different from a soccer game if the system is working as it should be. I don't know, I'm not an airflow expert, but that's there. The real thing I think here is, we've talked a lot about cohorts, and the basketball players are going to hang out with the basketball players. So, we can put masks on them during a game, but if we think that's preventing COVID amongst the basketball team, who's then going to go to school, we're fooling ourselves. I think the mitigation comes where we're still wearing masks in school, which changes our quarantine procedures and rules if we have that in place up until everybody has that opportunity to be vaccinated. So that sort of, gives me some comfort that that rule and those guidelines help us a lot to get to January. So, I'm not sure that, I think I'm leaning towards this idea that it really, those 5 players on the court don't need to wear masks, so long as we're doing all of those other things and we're making sure that the gym systems are working properly and there's good airflow, and the spectators are wearing their masks and all that business. So, long story. Sorry.
And I think we did say that we were gonna stick with the MERV 13 filters, like.
And we evaluate them every month, and all that's on. And the beefed up system also went into play starting in August. So whatever actually you had last year is even greater now.
Yeah.
But I want to echo what you said, and I'll compliment the student athletes again. And they're very responsible because they know what's at stake, right? So they know if you talk about they hang out outside of school. Obviously, they're hanging out. It's not a secret. But they're also responsible. I've seen it, and I know Dan has seen it. They're responsible to where even if someone has symptoms, they're not hanging out, right? They're staying home that night, and they're taking care of each other because they know the dominoes that fall. So we've seen it. Athletics, when I get to my update, I have a couple of data points that I think is interesting. It's very important to this community, and it's very important to our student athletes. So I think all the things that we have in place, as you mentioned, outside of that, will allow us to continue.
So before I weigh in, I guess my question is are we making this decision now, or are we going to wait to hear from the community? Because what's happened is we've made a decision and people haven't had an opportunity to say a comment about this. I'm happy to say how I feel and not weigh in, but I guess my first question, we're strictly talking about just about high school basketball students.
The middle high school basketball.
Middle high school. Okay. So when I came, I didn't make up my mind. I really wanted to listen to this table, did my own research. We did work on a presentation together, and this did come up. And when I'm working with someone, there is compromise, and that is something for me that was very important to me, especially being a board member last year that did not support indoor sports, and we know that was a very difficult choice, but I'm excited that we're having a season this year. And for me, it has been about the opportunity of being able to have the vaccination available for our population. Again, it's their choice, which is important to me. So when you look at the availability of our students having the choice to get the vaccination, for me, I wanted to find a compromise date of when did I feel that would be appropriate potentially for our students to be maskless for playing basketball. Those 5 players on the court while following the safe procedure that's been presented to the board. And I was around the same as Delcy, around December 15th, which was 2 games into the season, which gave them an opportunity to have, I think, 14 games maskless to play. Because I felt that at that window, it was enough time for our students who have a sibling, maybe on the team or in that general population, has an opportunity to protect themselves. Because the goal is, as a Board of Education, is to have our kids in person in learning and give an opportunity for anyone to not get sick and have that opportunity for that student, family, their choice to get the vaccination. So my compromise was to have it be masked until around middle of December. Maybe if you want to go to the end of December, but middle of December was where I was leaning towards coming potentially to a resolution of a compromise to have those students who have a family or a cohort, like multiple students in different locations, have an opportunity to get vaccinated. They won't be fully vaccinated by this time the season would start, but it would at least give them an opportunity to protect themselves.
So I guess my comment, just to the December 15th date, is like if a family the family knows what's going on in their household and they know that they have siblings and they have all that information. I don't, like, we're making assumptions now that there are basketball players that have family members that have this, that, and the other thing. And so if a family feels like it's a risk for their individual to play basketball, that's a choice that they can make, and maybe the student won't play basketball. And, but I don't want to make an assumption that all these things exist and then we're going to restrict our basketball players to wear masks on. So to me, I'm comfortable saying that it's optional. Those families that want that choice, they can have a mask, and that will do what it will do. But I'm also not trying to make the assumption that there's 3 players who have these kids and this is their concern, because I don't know that. None of us know that, and so it's hard to guess what those are, and then set in many ways an arbitrary date for when we'll remove something based upon a bunch of risks that could be true. Like, I'm not saying they're not true, but they're also, we have no idea. And so I guess I'm a little uncomfortable setting just a date.
I'm not setting a date. I'm just trying to kind of give you a feel for what I'm thinking.
Yeah, no,
being
I
able to provide an opportunity, because there's people who in our community are not going to like the idea of maskless play, and they have a voice. There's people who want their kids to be masked, or not masked, but vice versa. There's people who have a voice in their own opinion. And I'm just trying to find a compromise where the taxpayer who doesn't have kids in school, who want kids in person, paying their taxes, and they're not concerned about an outbreak or anything. So there's a couple of ways to look at it, which, it's how you look at it, Jim. That's my opinion.
Yes.
I guess just the one other point to bring up with, I guess, in my opinion, one more reason why going mask optional right up front would be of benefit is that if we're also only looking at the Hopkinton team. We're not talking about other teams. We haven't talked about if we wear masks required and a team comes and they are mask optional, are we forfeiting these games? Are we requiring other teams to wear masks? And then if they choose not to wear masks, this was something we ran into last year. And then if the other team is mask optional and we have masks on even until December 15th, again, it's 5 players on there would have masks on for sure, and then 5 may or may not. It seems to cause far more of a headache than is worth. Which, in my opinion, the risks and benefits just don't line up this one.
So we can keep talking about it. I mean, a couple options. You brought up. We've received several communications on this topic over the last week, and so I can open it up for anybody in the public that wishes to provide information on this. As you mentioned, you want to hear from the community. If the board would like that, we're happy to do that. Happy to move on with the vote. Happy to also, table this to the end after public input and then have a vote. I don't know what the will of the board is and how you want to proceed here, but I'm comfortable any option that choose your own adventure books as a kid.
I think if people have come and they wanted to voice their opinion on this, then we should have that option available now.
Okay.
And then we can proceed.
The rest of that.
Anybody disagree with that?
No, it's fine.
All right. So anybody who wishes to provide comment specifically on masks on athletes playing basketball, I would say please do so. Raise your hand and I'll let you come on up and just give us your name and what you'd like to say. I don't see any hands. Oh, Rita, come on up.
No, you go ahead, Rita.
Rita Blanchard, Concord, oh my God, I'm from Hopkinton. And I ran some numbers today on all the, on the incidence of COVID in our county, our town, and the schools. And I did miscalculate the school one, which came up, the calculation I sent you guys was at 0.5 or thereabouts. But I counted the 2 staff that are out with COVID. Shame on me, because that's a different subset of the community of the school. So with the 3 kids that have COVID out of 945 kids, it's like 0.317%. Now, Mr. Flynn did a presentation back in the day of this green, yellow, red light, and 1% was considered average, or some such thing. It would be like no masks. Correct me if I'm wrong. Then yellow was when it got to a higher percentage. In red, everybody had to mask up. I don't have his numbers in front of me. But it was when we were initially talking about masking this fall. That's just for the general school population. Kids in sports need as much oxygen as they can when they're playing. I played sports up until I broke my back playing soccer. And I cannot imagine being dripping wet with sweat, trying to run up and down the field. And then you're inside with basketball, trying to run up and down the court, sweating, you're trying to adjust your mask. Why even play? Why even play? I just think you guys need to set your personal biases away. Rob, I believe you said there's no way in heck you're changing your mind. But
I never said that this evening. I did not say that this evening.
not this evening. No, but at some point you said you used the analogy.
Said I had made my
like
decision. That's what I had said. So if
Right.
you want to say things, let's keep it in the proper
Well, I was
context.
keeping it in the context
No,
of
you
what you
weren't.
said a few meetings ago. And
Thank you.
but at any rate, in that same analogy, a mask is not a life jacket. And if any of the studies were looked at, what I asked in my email is show us the science. Put it up on the thing for everybody to see. Because I've looked at tons of science, and I know the effectiveness and the efficacy of wearing a mask just walking around. Forget about these kids playing sports. And I know kids have been hospitalized. Not at Hopkinton, but there have been kids hospitalized playing sports with masks on. They just pass out. So I really hope you guys will take the science into consideration before you do this vote. Thanks.
Thank you. Dan?
Need a tall microphone. Dan Mazur from Kentucky, I'm the athletic director. I can speak about this. I strongly support this idea of letting the athletes who are playing basketball on the court not wear masks. I'd be happy to talk more about that. The one point I really want to make, Norm, you talked about going to December 15th. Middle school games start November 29th.
Okay.
If we wait till then, we're 5 or 6 games into a middle school season. It is very, the challenge for me, where every other school around is going to say that masks are, as we're saying, while you're playing, you don't have to do that. If we do push it to December 15th, it's going to be a real problem.
Okay.
So I would ask you not to do that. I'm happy to talk about why I think masks should not be required while the kids are actively playing, but it sounds like at least the discussion is going that way anyway, so you don't need to. But I'm here if you have questions. Thank you.
I do have a question for you.
Sure.
So I just want to be clear, I'm being clear that the maskless play for the athletics will start when the game season starts, or is it going to be in practices also? I just want to know the timetable of this, because we're talking about 5 kids on the court. During practice, there's multiple kids on a court. So I'd like to know, is this strictly governed just to a game?
The way that I would do this, and again, I don't know if this is what the board or others would do, but I do oversee the athletic programs. The whole idea behind the mask is to mitigate risk. I think we all agree with that.
Yeah.
You know, the risk of wearing a mask in the classroom while you're sitting there, okay, it's a pain in the butt, but you know what, it's one more layer of protection. Whether we agree with that or not, it's not that big a deal. I do think the science is out there that when you're actively participating, wearing masks is at least a question of whether it's an issue for you or not. And so based on that, you know, at this point, we've had 6 months for people to be vaccinated. One of the slides you showed earlier, 72% of people 12 and up in this actually county. And I'm guessing Hopkinton is going to be higher than that, have been vaccinated. You know, my guess is the majority of people who have been there who want to be vaccinated are vaccinated at this point. So I look at it as a risk standpoint. It's a roundabout answer. But I would talk to my coaches, if you're doing drills where the kids are walking through programs, or walking through drills, or walking through things where they're not active, then fine, they should be wearing a mask. But if you're doing things that are full speed drills, the kids have the right to take the mask off if they would like to.
Perfect. No, I just wanted to make sure I had the timetable, and I think you make a great point about scheduling and all that stuff. And we're talking about 5 kids from us, and they want to be in that. Okay. Okay. Thank you.
Anybody? Yep. Come on.
Lauren Clement.
You can lower it. You're not as tall as me.
No, absolutely not. Lauren Clement, 86 Maple Street. Just a couple other things. I don't play basketball, but I do wear glasses, and I'm thinking from a safety perspective, if there's a player that's wearing glasses or goggles, and I believe they also wear mouth guards, a lot of people playing basketball, I can't imagine with mask on trying to take that out, and you see them adjusting up, fogging up, running down the court with a mask on. I can see it being a safety issue.
Max can.
I wear glasses when I play, and I mean, obviously, it is tough because you get fogged up. What they did do, which is really nice, is they got rid of the mouth guard requirement. So we did not have to wear a mouth guard with the mask, which is nice. Nobody ever likes wearing the mouth guards. We never wore them when we pickup. We never did them. Like, unless you're playing organized basketball, that's the only time we wear a mouth guard playing basketball. So, I mean, take it out what you will.
I guess that's optional on your parents and how much they spend on your teeth. The other little point I wanted to make is kind of following on what Norm was saying. You're talking about 5 players being on the court. That's standard gameplay. When I was in high school, you warm up, the guys rip their jerseys off, come running out. They're all playing. They're doing some loops and drills and shooting and doing their thing before the game gets started. So you're going to have them wear masks. The whole team wear masks during that part, and then when game actually, there's a lot of variables here, so I'd support making it optional for the players.
Thank you.
Tricia Lambert, 305 Galloping Hill Road. So we're very much in support of removing the mask as much as possible. A lot of you said a lot of really good things tonight, and I'm going to say it, is that I heard it should be choice in this conversation. And that should have been from the very beginning. Now, I understand you make decisions. None of you are doctors, but you're playing one on TV. And so having my daughter wore a mask last season, and they did remove the mouth guard. And we paid a lot of money for her teeth. So what risk are we mitigating? You're mitigating a mouth guard versus a cold that probably someone her age would have. So that's kind of a double-sided thing there, but the point is that you took an oath to the Constitution, and you should uphold it. That's the first thing. So the second thing is I heard Jim say it impacts performance. So if you are wearing a mask and that impacts your performance on this court, what is it doing to your brain while you're trying to learn? And this was part of this discussion, so I'm bringing it up here and now. So impacting performance, it was said. So what is it doing to your brain? You're breathing in your own CO2. Thank you.
Hold on 1 second. Yeah, no, sorry.
Hi, Cheryl Morse, up the road, 396 Park Avenue. A few things. One thing I'm sure you all know, that the COVID particles, a nanoparticle, and unless you're putting N95 masks on them, they're passing stuff anyway, everywhere. So that always keeps the validity of the mask in question. Secondly, when I believe Norm brought up that what about the feeling that some people have that their child should be wearing a mask, and they're perhaps wants the rest of the team too. But we are as a school in critical thinking, we are trying hard to get our children to take personal responsibility, and that's about critical thinking. And personal responsibility is that every child and every parent takes care of their decisions. So hopefully you as a board understand that it can't be about the voice of one, because there's so many people that have that issue that makes it that they have to stay home or they can't participate, or it's life. It's the things that you learn. And lastly, I've been subbing in your schools for a couple years, watching those little kids run on the playground. Thank God it's over now. But the masks on their faces, and they just stop and they just wilt and they're sweating. A few of them, the mask would fall off. I don't want to tell you what the inside of the mask looks like. I'm not even going to go there. But just to watch their performance, if you want to call it that, as they're trying to run in the playground, and they're sucking the mask in, trying to get in enough air while they're running. It's sad. So I hope that you follow your better instinct, which is to move forward with this. Thank you.
Dave Lampert, 305 Galloping Hill. So, I guess I'm very happy to hear that a lot of people are considering masks optional on the court. Which it should be, because you can't run back and forth and not pass out. You're worried about liability and the school being sued. How many students with masks running up and down potentially could pass out, hit their head, whatever, out cold? But the next question is, you're saying when they're on the bench and they have to wear masks. All right, the team has what, 12 people, maybe 14 tops? They're all practicing during the week together. So, and you're all saying that the masks are worn, we wear our masks to protect somebody else, right? It's like, so the 5 people or the 10 people on the court that are playing, they're in their face, jumping around, sweating, drooling, spitting on each other. They're no threat to anyone. There's no threat from them at that point in time. But as soon as they sit down the bench, they become a potential threat to everyone else in the gym. How does that make sense? Meanwhile, at that point, they're still, they just came off the court, they catch their breath, and they still need lots of oxygen. So you're going to put a mask on and stop that from happening? I mean, how many times when you get off the court, you sit down, you still, the room's kind of, you're feeling a little lightheaded because you're, really out of breath. So you're going to put a mask on your face at that point? Does that seem like a great idea? You were just on the court playing, you weren't a risk to anyone. And all of a sudden you sit down and like, oh my God, you're this big risk to everyone in the room. It doesn't make any sense. It's the same core 14, 10, 12 people. They're together. They're in the locker room. They're in the gym. They're practicing. On the bus, they shouldn't even have to wear a mask on the bus. How big is the bus? They could sit every 2 rows or something like that, and then we're 6 feet apart from each other. It doesn't make sense. The mask, it's all show, it's all optics. And then he's going on what Joe was just saying about the mask, the real efficacy of them in general. I mean, for starters, if you have facial hair, the mask is useless because the amount of gaps that the facial hair pushes away, You might not even wear it. What's the point? It doesn't seal at all. So again, these student athletes, they need the oxygen. They need to play. It helps their immune system in general. They're active. They're doing something. They're probably the healthiest people in the whole school. And like you said, they probably stick together as a group. They're not going to be out partying because they're going to be in the gym practicing till 9, 10. I mean, some of the practices don't even start till 9 o'clock. This makes no sense. It's a science fiction, not science. I mean, I appreciate you guys also waiting to the end of the meeting to listen to public comment. And one other thing, and I know I'm going late in my time. In the slideshow, they said if we're still at the same spread rate that we are right now in January, then we should go optional in schools. So why are we waiting until January? If where we are right now is okay for January, why isn't it okay for right now? I don't get it. I really don't. This doesn't make any sense. Unless we're stuck in this lie and we have to, we can't admit we were wrong. Maybe that's the case. I don't know. But at least for our athletes that want to get the exercise, compete, there are potential scholarships in their future that you're ruining because for no reason. So, all right. Thank you.
Thank you. Anybody else on this topic? All right.
Can I ask some questions to Mr. Flynn on a couple of things on this?
You can ask questions.
Are we
to Mr.
voting on
Flynn.
this later or no?
Why don't you ask your questions to Mr. Flynn, and then I'll come back to the board.
That's a Jim question.
Huh?
That's a Jim question.
Does Jim has a question?
No, if we're voting on it now or later, it's a Jim question.
Yeah, so, why don't I ask Mike his questions, and I
Okay.
can come back to the board to see if we're all understanding where we are, and then
Okay.
we can move forward from there.
Perfect. Dan ran a successful season last year, and I understand some of the comments he said, and I appreciate the comments. My question for you is, and I need reassurance to make sure I understand this correctly. Our mask mandate still is in effect, based on what we have discussed here, is for anyone using our facilities, correct? If we were to have masks optional for those students to play basketball, that is only for high school and in the middle school, correct? So we will not be having 12 and under kids playing basketball in our gyms, is what I'm saying, that aren't vaccinated with no mask.
So we have facility use requirements.
Correct.
And if we are only making a change for middle high school students, then that's what the change would be, middle high school students.
So middle school, which is 12 and up, correct? So your agreement with facility usage would not change because of the mandate we have and the
Correct.
agreement you have?
They're separate conversations.
Okay, that's what I wanted clarity on.
Is that the only? I'm sorry, you said you had a couple questions. I didn't make sure.
That was a lot of questions. No, that was the question. No, I want to. A lot of people look at the board for guidance, and I know there's an agreement between the superintendent and other, like farmers market and all that stuff. I just want to have clarity, making sure that a decision that I'm making tonight doesn't have a ripple effect on multiple things within the district. That's what I wanted clarity on, and he answered that question.
Okay.
So, thank you.
Rob?
So I just want to speak to the question about when players come off and when they remask. Because I think that it is a good point. Like anybody who's played basketball knows, sometimes you come off and you're like, yeah, okay, I'm fine. And other times you come off and, whoop, I need a little break. So I think that, there's a reality there that there should be some discretion on the part of the coach to say, all right, let's set this up so that when people are coming off, they're going to be at the end. And when they're ready, they remask, that it's not like you take a seat.
You should get some water too.
Yeah. So, there's a reasonable way for that to be managed by the coaching staff.
Yeah, we have, that'll be under the safe practice protocols. We'll have that in development with Dan to ensure that space, to recover.
Right.
Yep.
Yeah, we're setting guidelines.
Yeah, just general.
Examples hard. Max.
If NBA players are able to do that, I don't see why we couldn't do that. They come off the court and they put on a mask. I think that if they can do that, we can.
Can you dunk like them too?
I can definitely not dunk like them.
Okay. Yeah, that's cool. Just want to
but
see how far that goes.
I think I could put on a mask like them.
Sorry, I didn't mean you couldn't dunk, Max. That was. A suggestion.
It's a struggle. Not Brendan.
Any other thoughts? And then I'll sort of revisit where I think we are, and we'll see if I'm right.
Awesome.
All right. So where I think we are is we agreed no limitations at this point on visitors subject to change with circumstance, but it would be a mask requirement for attendees to our games, and then we'll have mask optional for players on the court playing games. And then Dan, I think, will work with his staff and his coaches to ensure that, as practices are going, that they're following, health and safety guidelines, to ensure that their players they're accommodating as much as they can, the masking, while also allowing for participation. That's where I think we are. I just want to check on that. I'm seeing nods.
Yes. Yep.
Okay. And so I guess what I would ask for, because I have nothing written down, is there a motion to approve winter middle and high school basketball with those provisions, what we just laid out? Is there a second? And we can adjust that. Is there any amendments or adjustments or clarifications needed?
So this is just basketball, and we haven't talked about hockey yet. This is just one sport, right?
We just tackled one sport.
All right. Okay. All right.
So I did second that, Jim.
Yeah.
Okay.
Yep.
And any further discussion? All right. All in favor?
Aye.
Anybody opposed? All right. Ayes have it. So, hockey. Dan, or
I could actually probably speak pretty well. I've been traveling rinks now every weekend since August. So,
and used to play.
Yeah. So my recommendation, not that I've connected with Dan specifically on hockey, because I think facilities, basketball is our facility, is each rink has their own requirements. We were just in Hanover this weekend and couldn't enter the building without a mask. The only people that were not allowed to have a mask, this is just the Hanover rink, the only people without a mask were the only people allowed on the benches. So coaches and players were the only ones without a mask. When we left the bench, we had to put the mask on to go to the locker room, so forth and so on. So each rink has their own requirements in place. That's why I pointed to NEC. I would expect NEC's requirements will be relatively restrictive, especially at the NCAA level and what they're using and how they're letting them use it. So my recommendation would be to follow each rink's requirement for our hockey players, and that would be basically the rules for that. Is that simple enough for you? Every rink's different. Hanover's probably the most restrictive we've been to. We don't travel to Mass, right? No, Massachusetts has some, BG has some, so depends on what rink you're in.
In my head, I think it's sort of a similar conversation where if you're skating on the ice and play, mask on, and for everyone else off. And
well, hockey's just a little bit different because you're on about every
3 minutes.
3 minutes.
Yeah, but I think coaches could be or whatever. I mean, I know they're in and out in the penalty box, blah blah blah. They won't have masks in there.
Yeah.
I wicked care about. That's a super New Hampshire saying. I really care about locker rooms because I think that those are tight spaces, and obviously, no one's going to be in checking a locker room. But I think the heavy recommendation should be for players and coaches when they're not on the ice, regardless of what rink they're at, to mask as part of sort of
Yeah, so transportation's still out of our control.
Yep.
That's when you're on a bus, you're required. Doesn't matter. And then it goes back to the plan with Dan and the coaches, and making sure that nothing brings down the team or the season. So that speaks to that point. So that would make sure that the safe practices and procedures are followed so that we can have a hockey season. Because New Hampshire experienced it firsthand when they shut down all of hockey last year because we became a pretty distinguished area of spreading. So I guess that's the best way to say that. So.
Any other questions for Mike on hockey? You need to vote on that?
No,
because you're following what we're voting on is just following
the support. Yeah,
support the practice.
Yes, support safe practices,
and what rinks are doing. So it's hard to vote on what rinks are doing.
Yep.
So.
Is there a way, though, to say that I know it's also a dual school district for hockey, but if there is a way to have it be that the players and coaches will be masked off the ice, it is just such a tight space in those spaces that I think it...
Yeah, it goes back to exactly what we're going to be doing with basketball.
Right. Yeah, but just like, even if the rink is like, who cares? Like, you know. having it
It's
be for our
interesting, some of
players.
them, some schools that we're going to for basketball aren't even letting you use a locker room, so
Yeah,
all those things come into play,
yeah.
as you mentioned, yeah.
So Dan, you understand what Dulcie's getting at, I assume?
I do. The one thing that I think was, John Stark does not require the players to wear masks while they're playing. They're the lead school, so while our kids are playing, they don't expect them to wear masks.
Right, but when they're-
I understand the rink, that's more about fans and stuff. On the bench, as Mike said, if you're an active hockey player, 3 minutes, you just catch your breath.
Right,
And
but
it's a great point earlier about when you come off the basketball court, you're gonna get a chance to catch your breath before you put the mask on. We're not gonna stay both to each other. Same thing with hockey.
Right, but just for the players when they come off, yep, off the rink, like,
Locker rooms,
Yeah,
locker room's the
locker
best way to
rooms,
say it.
yeah, yeah. Great.
And everybody's, we're all cool with that? I think it would be cool to use your. I should have, yeah. All right, is there anything else on winter sports we need to talk about this evening?
No, we're in great shape, good shape. Questions? Perfect.
All right, thank you, everyone. That's great. So next up on the agenda is policy. So I'm going to turn it over to Andrea for our BBB, BBBC, BBE, and so on and so forth.
Actually, do you mind if I cut you off, Andrea?
No, go for it.
All right, so with
No
Paul.
one wants to listen to
I know.
policy.
Uh,
I know. This is
With
legit.
policy, I was not present at the last meeting. You guys asked for them to be added. Even looking at it now, I think I'm going to alter it for the next meeting. So chances are you don't know what BBB is, right? Okay. So starting moving forward, it'll be BBB and what it is.
Perfect.
For the agenda. But also on the agenda, now that we're going to get to overlapping meetings, so believe it or not, EBBB, IC, IK, IM, BC, JEC, JLCJ, JLCJA are all should be here for second read and approval. Okay, perfect. So that's moving forward, just so everyone's aware, you'll see 2 sets, right? You're going to see the new ones, and you're going to see the second read ones. Okay?
Perfect. And having the description's awesome.
Perfect.
That'd be
Yep.
so helpful.
Yeah. So you're going to present
Oh, so
second
going
read.
back to me. Okay, so just to circle back to what I presented last week, and I know I've had a couple of side conversations, but I didn't know if anyone had any substantive either questions or revisions needed for any of the 6 policies that I presented last week. They looked okay. I know they were exciting reading.
They look great to me.
Great, thank you. I mean, these are all, they're all updates based on legal precedent, so it's statute updates. So if there are no questions, they're up for a second read tonight. They look good. At our next meeting, we will re-ratify these because these were all separately live, we're on our books already. So up for first read then, we have the Bs, a lot of Bs. And for folks who don't know, so B, these are all policies that we actually did have on record in a big binder, but we did not have them digitized. And so part of our looking through our policies and making sure that they're all up to date is also making sure that they're digitized so that everyone can access them. So B is school board governance and operations. Because they're not listed on the agenda, so we have BBB, which is school board elections, triple B and C, which is board member or district officer resignation. Triple B and E are vacancies and unexpired term fulfillment. We also have BEC, which are non-public sessions, BEDG, which are meeting minutes, our meeting minute requirements. And then we have one additional one, which is under I, and I is just general instruction. And this is around academic freedom, which again is one that we had on the books and are just updating. So Mike got to be the lucky policy committee member to update these. Mike, I didn't know if you had any highlights for these new first reads. That
No,
you wanted to-
I would just echo that, some of these, policies aren't out of date. That's not the right way to say it, but we had a goal as a school board to bring 7, I believe, per meeting, and it's just reaffirming, reevaluating, and making sure that it aligns with what's going on. So when you look at unexpired term fulfillment, I know it's exciting to everyone, but talking about if someone were to step away from the board, that would only be filled till the next vote. So just making sure that all those things are re-updated and aligned with RSAs as needed. So no real highlights here. Pretty boring stuff on this one. I'll be honest.
Speaking of boring stuff, just curious, not that I'm planning anything, but look, what is the procedure for vacancies? Like, how does that work?
Go ahead, man.
So what I've experienced in the past of if I have a heart attack and drop dead and you need to fill my spot, the board chooses. So it's a vote of the board, put someone on, and so boards have done it in a variety of ways. You could you could ask for volunteers, and then you have a volunteer pool that you pick from. Other boards have looked at past board members and tapped an unlucky fellow or gal who had been on the board before and to come in and sort of serve through that term. And some boards had looked at the last election and who had run and garnered the second most votes, and then talked to that person. So there's a whole bunch of ways. There's not really one standard way.
So that RSA in
It's
there
the
is
RSA,
pretty
yeah.
broad.
And then
It allows you guys to determine your rules.
Yeah.
and then it comes to the next election. So, like, again, using my example of me dropping dead, I had 2 years left in my term, and so you would go to the next election and you would vote to fill my 2 years left in my term because you still want the term staggered as they've been. So I'm not going to drop dead.
Well, you recently filled one with Mr. A-Frame, right?
Yeah.
Oh, that's right.
Yeah.
We
Yep,
filled-
Seth was one year term.
We
know
filled
that
one.
guy.
We just filled one on the budget committee,
Yeah.
same format that was appropriate. I felt, previous elected official. So I think that was important.
So that's policy. Any questions?
More of a general statement. It was only I didn't get a chance to read them all. And what's I guess is it best for me to just to name my general statement, or is it better just to email you guys?
Is it
as for a
specific
second
to
read?
this read or the second read?
It's specific to the first read. What's the better approach?
So are you talking about the Bs or the ones that Andrea presented 2 weeks ago?
I was talking about the Bs, the ones on first read tonight.
Oh, you bring it next week?
Okay,
Discussion.
so bring it next week. I'll do that.
Yep.
It's gonna be great.
Good. Great.
Questions?
All right. Nothing else on policy.
I know how to wow a crowd.
So next up is budget.
Yeah. So I want to say thank you. I guess that's the easiest way to say it. I kind of flipped the district upside down with some of my goals when I started here, more specifically around the budgeting process. It has, I'll say, been stressful for staff and administrators. I know you all have gone through a new process with me, but I want to say thank you because I think the reward after tonight hopefully sets us up for November, December, January, right? Not necessarily the budget specifically, but more about the opportunity to work with the town as needed, talk to stakeholders as needed, and kind of be able to communicate the why rather than all of a sudden a number showing up in January and everyone says, well, what the heck? So I want to just say thank you to everyone involved for sticking with me. Next year, as I keep saying to the administrative team, everyone knows what's coming, right? It's not a secret. It's not what's this about, how does this happen, what's the budget session, all that stuff. So I think we've gotten to a good part. And I've actually enjoyed the dialogue a lot. And I've enjoyed the conversation. It's opened my eyes to past practices. It's allowed the current staff to talk to me about needs and wants, and really getting to this point. And I think, again, starting next year, I don't think there'll be it's going to say weird, but it won't be as much discussion as knowing where the outcome is supposed to be, and that's tonight. So, Ms. Clark, are you still there? I put you behind. Sorry.
Before we move on, can I just say something
Yeah.
to what I actually want to thank you, and then we've talked about this a bunch over the last month.
I'm just gonna let Michelle see you guys.
I think the process that we've undergone thus far has been great. And it's not only that it's earlier, which is wonderful, but I think the work sessions that we've had with the administrative team have been, I think they've been great. We've brought a lot of issues that I haven't heard in the past brought to the table, and I just think interacting with the administrators in that way has been really helpful. And then two, I really like the timing. And while it's a little odd because we haven't done it this way, here we are on November 9th, where we're going to get, not to a final place, but we're going to get to a place where we can then leave the budget and not scramble through the holiday seasons with everybody being stressed and overworked and trying to figure out the budget to get to it at the last minute. But we have time now to sort of hear from the community what they think of a proposed number, give you guys more chance to work on to get more information to come in, which just feels like a much better decision-making process than I think in the past, which has really been, hit the pedal to the metal, get really stressed out. I'm looking at Michelle, and then try to then get the community to understand all those changes really fast. Anyway, so I just want to thank you for bringing this process because I think it's been helpful to us.
I appreciate that. Keep going.
Keep going.
Can I go? Great, perfect. No, I appreciate that, and I've been flying Michelle's flag since I started, but she is a whiz at what she does, and even when I go down to her office 5 times a day and say, well, how about this or how about that, what she executes and follow throughs on is outstanding work. So without her, we wouldn't be here today. I'd say one of the things that I've had to adapt the most from my previous now 9 years of budgeting with Timberlane and Hampstead is it's a little bit of a role reversal, meaning in Timberlane and Hampstead, we focused more on the numbers and final numbers rather than necessarily position. Don't get me wrong, positions, all that's in there, but really it is, at the end of the day, what does the board want to support in regards to percentage increase overall as well as tax impact. And I think over the last week or so, I think we've all gotten to that spot to, all right, we're not going to keep going back and forth on this. Give Michelle and I a number, tell me the number, tell us the number, and we'll come back whenever it may be, December or January, with that final what puzzle we put together and how we were able to get our final numbers in and present to you in the community where we're at, right? We can go back and forth on 15,000 and 20,000, and at the end of the day, the real scenario is what's the appetite of the community, what does the budget committee feel in the town, and what does the board want to support? Because we all want to make sure that we're taking care of everyone. So I think that's the goal of tonight. You guys giving a solid recommendation to Michelle and I, and then we put the puzzle together for you to finalize. Whether we present soft in December or January, whatever it may be, it's up to you guys. So, Michelle, anything to add?
No, that's great.
I'm going to ask to make a comment.
All right.
Do we have any attachments? I haven't seen anything.
Nope. So what would you be looking for? Because
so we got I know we got the ESSER breakdown of what we are proposing that going in there.
Yep.
I know I saw that.
Mike,
that's your document. So that was that was yours.
This cover sheet, I was thinking it might be a good idea to make some quick copies and share our discussions from finance, just so, because it sort of dials that in.
Sure.
But the copy machine won't let me copy anything because I no longer have privileges.
I don't know if I have permission.
Yeah, it's like a special code over there.
Do you know the code for here? Michelle, how do I make a copy here?
So
it said,
actually,
no way, you're deaf.
There's no code.
Matt, can you help us out?
Oh, then take a picture and just email it.
I could do that. Just 7 copies of the top sheet.
So Norm, in regards to supporting documents, we didn't, Michelle and I didn't create another, I'll call them scenarios?
Yeah, no, that's
Okay.
fine. And I know that he has that. That works out great. Just the one question I had is we're going to determine a number, which we've talked about in multiple meetings. What positions and stuff will be discussed later with you. General discussions like Rob had talked about, for example, fully funding graduation.
Yep.
That's something I'm really
Sure.
I want to move forward with. So if that's something that I don't know if I got to add that to the number tonight.
Nope,
For me, I want to give you direction saying I would like to see that moving forward, that we are fully funding graduation.
And that's perfect. And Michelle and I, that was already in our stuff.
Yeah, good.
But that's that we can't keep going back and forth.
Yeah.
You say, you know, in last meeting, you guys went down the list and you talked about what you support.
Yeah.
So we have all those pieces.
Good.
But the overall, let's say the number 650,000.
Yeah.
We have to ensure that graduation is in that 650,000.
Okay. I just want to make sure something like that, because I know we had the discussion and,
Yep.
you know, okay, that's what I want to know. Perfect.
And I also just one more time want to reiterate, and I've said it to you guys several times, the number's the number to us.
Yeah.
And we'll execute no matter what the number is. We'll continue to do a great job at it as well. I think the strategic plan, which we'll get an update eventually, that'll lend to some further forecasting and budgeting. But I just want you to know that whatever the number is, we'll be able to come through. Thank you, Rob. Michelle, do you have this digitally with you, or do you bring it home?
Yeah, I brought it home.
Okay.
Thanks.
So this is just a frame that, so this is kind of a fast forward on the last finance committee meeting. So we had asked Michelle to run some different scenarios and what it would look like in terms of the overall increases. And then on the right, you see how that plays out in terms of a tax increase. So some of the Rob NATO code that's in here, that the scenario 1 was all of the positions that we unanimously agreed to. So not curriculum coordinator, not facilities, but all those that we set. And that was 2.5%. And then you can see the tax increase rates on the right. And the first one is with, correct me if I'm wrong here, Michelle, $200,000 coming out of Article 10. And the one on the right is if we took $300,000 out of Article 10. Okay?
Can you hear him, or do you want me to move you over there?
I can, yeah, no, 200,000 was the first scenario, yep, from Article 10, 300
Yeah.
was the second, yep.
So in that first scenario, the tax rate just on the budget itself would be $1.13, but if we took a little bit more out of Article 10, it'd be $1. The second scenario was all of those unanimously agreed upon positions and the facilities director, where we talked about that at 72,000, and that would be the percent, and use the top number in terms of the percent increase, because the bottom number is a reference to, we had to put in expenses the money we would spend out of federal funds coming, so it sort of bumps the number up, but it's a misnomer because the money's going to come back.
Yep.
So it's not really an increase. Then the third scenario was the curriculum coordinator position with unanimous, and then the last one was both facilities and curriculum coordinator. And so we got to that number of, then with the warrant articles that have been established so far, at least that we think are established. So we know what the Hess contract is, what we would like to do with maintenance trust, what we would like to do with the tech trust, what we'd like to do with special education, and then the health benefit trust. So those are all there. What we don't have is the HEA numbers. So you can see the associated tax rate increases there as well. And then the other stuff that's here, just up in the top left, that's what we've got in Article 10, 679. The projected fund balance that we have to hit for revenue is at 580. And then in each trust, down in the lower left, that's currently what we've got. And then the ESSER positions that we are funding, that we've talked about thus far anyway, is 186, 650. So you got to kind of think about that projected into the future as well, at least some of them projected into the future. So that was the discussion, and kudos to Michelle. I think I sent this out at like 7:30 in the morning. I was like, this is going to take a couple of days. Nope, it's going to take till 1 o'clock in the afternoon, and bam, there it is. So there are subsequent pages to this document that lays everything out. When we left our meeting, we were really talking about, target around 3.5% with some movement in either direction, not factoring in at that point where we are with the HEA contract. So.
And just one more point. Since our finance meeting, the agreed upon positions, Michelle and I have eliminated the nighttime custodian position as an agreed upon position. We have a different plan in place for that. So that was 37,000-ish, right, Michelle?
Yep.
Yep. So just so that what you're looking at minus 37 is essentially that, what you said up or down, which is, I just wanted.
Yeah. And I think the other thing that's important for all of us to remember, and for the folks who are, perhaps listening in, is that our first run, when we looked at the operating budget, and we were looking at some of the splits and just asking Mike and Michelle to go back, and when they came back, there was a $91,000 reduction. So, 2 years ago, people said, we'd like to see a line item. We now have line items, and we went to that and looked, asked some questions, and things were revised. So I think that our process is improving, and we're seeing the evidence there.
Thank you, Rob. This is helpful. How do folks want to proceed? This is great in terms of sort of laying out percentages, and so we can respond to where we feel comfortable. It's probably best, I guess maybe I'll just put my thumb on the scale. I think it would be great if each of us just sort of looking at this and looking at the numbers sort of expressed where their heads are and trying. So Rob, since you sort of laid this out, do you have a preference, or where's your head at?
How to phrase this. What's best for the schools and what makes sense moving forward. And I think, sustainability-wise, somewhere right around that 3.5, but there's a margin, probably 0.3 in either direction. So when I'm looking at the right-hand tax rate of $1.51 to $1.63, that probably puts us right about in that zone if we're talking all in at 3.58 to 3.98, which is probably high. But as close as we can come to that 3.5%, I think is sustainable over time. If we were, I'll leave it there. And you can kind of see the impacts. I did the impacts on a $300,000 house on the right-hand side of that. Again, and the variation is with the two, how we're using Article 10. So 200,000 would be the left column, and 300,000 would be the right column.
And right now, I think it's okay to say out loud, at that 3.5% up or down on a $300,000 house is either $492 for the year or $453 for the year, depending on Article 10.
Correct.
Okay.
Right.
And that'll be a part of the final. I don't know if you remember my interview, how I broke it down 2, 3, 4, 5. So that'll be a part of that final when we get there.
Right. And that would be, in this scenario, it's all warrants. Everything's in. The operating budget, the warrants, not.
Which one?
I think you're looking at, any of them, but scenario
I did
2
it,
was the one that Mike did.
3.58.
3.58.
The ones he circled.
Yeah.
Sorry.
Yes.
No one was talking, so I figured I have no problem with doing that. So we still have a bunch of unknowns as we're sort of moving. Everything that we're doing we have a bunch of unknowns, which is why it's great that we're doing this now, and then we have a second pass. And so I don't disagree. Trying to get, I think 3.5% is a pretty sustainable number. And so as I look at these, I guess for now, I would err on the side as we think about the operating budget, right? Because we have the warrant articles as well. But as we think about the operating budget, to err on the side to keep that as low as possible. And so we have some expenses that we know are going to come in, which is the bond payment. We have the change to food services. I don't know if that's the right term, but we know that's a cost. And so I think without the positions, or without adding positions, I guess I would defer to a lower number on that operating budget, knowing that as we move forward between now and January, we can add. We've had really good discussions on everything that's on the table, and we can add things in. So I guess for now, I would feel more comfortable being conservative and maybe start by not adding a bunch of positions in. We have the ESSER positions that we talked about that I wouldn't mind revisiting in a minute. But things, you know, we've had a ton of conversation around facility director, we've had a ton of conversations around curriculum director. I think we all support those things, but it's also hard as you start adding those in now. Getting to that 3.5% gets much harder, especially with some of the other costs that we've already mentioned. So anyway, I would try to back down on the. I'm looking at scenario number 1, the 2.5%, and see if we can get there, if not a little lower. And the other piece that just is on my mind is the ESSER funds, because I'm also thinking about like next year, and so I don't exactly know how to do it or how it fits in. But you know, like the 5th grade teacher, we've talked about this a bunch. Like that is something we want in this budget as something we've all said is a need, and we know it's going to carry over the next year's budget. And so if we fund it all this year, ESSER is just going to be whatever that increase, I forget the number, like 85,000 or whatever it is, increase next year. So do we want to think about maybe splitting some of the ESSER funds for some of those positions that we know is going to carry over, because that's going to blunt some of the effects in our next budget, especially if we want to bring in things like curriculum or facility into that budget. Having a little bit of headroom to me makes sense, but how that fits into a 2.5%, I'm not overly sure, but I think that could work.
So essentially what you're saying is that 2.5% number that did include the positions that we did unanimously agree upon.
You said
At 2.5, it did.
So that'd be minus the 37 now.
Minus the 37.
Right, minus the 37, right.
Yep. So what I was speaking, I'll call that the spending money, right? So we have the bond that we know is coming. We have the Hess, the HEA, and then what's left over, the percentage, is the spending money that Michelle and I would put that puzzle together to see what we can fit, and whether that is, like you said, half in on 5th grade, knowing that it's going to be an impact next year. We would come together for a full plan how to meet that 2.5%, if that's the goal. Yep.
So just to remind people, not if you need, I always need reminding because maybe it's the gray hair, but taking out the custodian, it was the numeracy, the administrative assistant for special ed, and it was the administrative assistant guidance at the middle high school, and the others were ESSER.
Correct. Right, yeah. And those positions would still be in.
Right, correct. And Michelle, remind me if that scenario 1 included the bond payment, because I think it did.
It does.
Yep.
Yes,
Yeah.
okay.
And the change of food service too.
The 199,000.
Right. So with that calculation, that's a really pretty good target number. I mean, that's a pretty exceptional job.
Yeah, and I think that's hard, right? Like the budget was, the bond payment specifically was set on the prior years. That's something that the taxpayers already decided to do. That's a level that was set. And so I think that everyone needs to be mindful of the fact that while it does impact the tax rate, that was something that was voted on years ago and agreed to, even though it's a multi-year process, obviously. For me, I mean, we bang this drum in finance committee, CFP, every 2 weeks / day. But what we care about is we want to move away from a fund balance, right? We want to, number one, do that. And we know that that's not a 1-year process, that's a 2 to 3 year process. We want to set ourselves up for a really solid base for this school district. That includes looking at things like ESSER funds, that includes looking at things like the maintenance trust, that includes looking at things like what can we do over a period of time such that we are asking for a reasonable rate year over year versus these huge swings. That includes setting ourselves up well for success with trust so we can do things like tax rate stabilization from benefits, special education, etc. I think 3 for me is I also want to make sure that we're setting together a cohesive picture for this year, specifically with our contracts as well. And so when I think about that, I do think that I come in a little lower. I don't know if I'm fully at the 2.5, but I think I'm probably somewhere in the 2.5 to 3 range to start of. And then as we move through getting the fuller picture of where we are across the full scope of warrants, being able to go back and say, how are we looking?
Yep.
And that's sort of where my mind goes.
The only thing I would throw your way, Michelle and I have wrestled with this because you brought it up, Dulcie, in regards to getting away from fund balance,
Yeah.
okay, and it being a multiple step process. Michelle and I keep coming back to the food service.
Yeah.
Right. we've used terms several times this year. One is slaying the dragon, and that is slaying it right off the bat, and that's 150 grand. So I'm looking for almost support in regards to having an opportunity, not saying it has to be final,
Yep.
but making that a multi-year recovery process too. So 75 next year and then 75 the following. If you guys are okay for us to allow that opportunity to be a part of the puzzle, I just want to open up all those options to make sure that we're able to hit numbers.
I'm okay with that, and I think the other piece of that equation is also looking at that ESSER position, and if we're looking at that fund balance, like being able to think about that as a multi-year step down.
Yep.
But yeah, as long as we're doing multi-year forecasting, right?
Yep.
Like we're not committing to anything, and being able to say we're trying to address these fundamental drivers of the budget across all these things, I'm good with that.
Well, this is when, I mean, you pay Michelle to be the business administrator, right?
Yeah.
And she went full business administrator on us in finance and was telling us about how to do this and this and this, and we said, okay, so I just want to allow her that opportunity, because that's one of the scenarios she brought up the other day is, what do you think that they would support doing a half-year split on that? That could help us with some of the scenarios that you talked about.
Yep.
Yeah, I guess, Mike, I just would want to make sure that we don't run into, again, needing to freeze the budget for any kind of extended period of time.
Mm-hmm. We're in good shape right now.
That would be my main
Yep.
concern, so as long as we're in good shape.
We're in good shape for this year. Okay, thank you. Thank you for the head nod.
Thanks, Michelle.
I think for me, during this whole budget process, it's been a great discussion, and I think to hear from Mike on a weekly basis about this, I wanted to provide him with an opportunity to present us with what he felt was best to run this district, since this is his first budget with the Hopkinton School District. And I wanted to give him the opportunity with with I think a sustainable increase, with a reasonable increase, where I was falling in the lines around 2.84 on the tax impact scenario 2, which it's a little bit off from where you are, Jim. That's where I was kind of looking at, because we're not picking positions, but facilities was one of the big things we had talked about many times. But when we create a number, you keep mentioning going up. To me, in my opinion, I was probably looking going down potentially. Who knows what happens in December? We could have some more revenue. We could have some things at the end of the road that Michelle may say. We could have this. I wanted to give him enough time of, let's say, a 2.84% to be able to present us with what he really feels with. Because when you set a number, you kind of want to come back and hear maybe less, if with more missing pieces. Does that make sense? That's kind of where I was thinking about a little bit.
Did you want that right now?
No,
Okay.
no.
Okay.
So
Yes.
Yes.
Just say,
No, I'm not. I'm not asking you what you'd fill a budget with 2.84.
Sure.
I just don't want to limit you to 2.12. That's meet the needs for
oh
our
no.
students.
So go ahead, Jim.
Yeah, well, so part of my thinking, so when you look at, so you get the 2.84 and then the all articles.
Yeah.
3.58. So we don't have all the numbers for all the other articles.
Correct,
So
yeah.
I guess, so my thinking, is to start at a lower operating budget
Yeah.
number to see what the room is for the rest of the warrant articles that we come
Okay.
in, and then if it comes in at, all the articles come in less than 3.5%, then we have a conversation on the delta of what to do with it.
Okay.
But if we ask Michelle, this is just my opinion again, if we ask Michelle and Mike to take that larger number, make a plan based upon, and then we get the full warrant picture, then we're gonna be back to a conversation about what are we gonna take out of there to get there. And I guess I'd rather be in the January conversation, having an additive conversation rather than a subtractive conversation.
Okay.
So that's where my head was. So I'm starting at a lower number until we get all the information, and then revisit at that point.
Yeah, so it's kind of the opposite of what we did last week, or 2 weeks
Yeah.
ago, excuse me. So when we come back, whatever December, January, whatever date you determine, we'll come in at that number I wrote down. I wrote down 2.1 to 2.6. That area, and then on the side will be, all right, there's this much money,
Yeah.
spending money, where we want to do this, we want to do that. So it's the target.
No, and I'm not trying to be difficult.
No. It's really a question: do we want to be additive or subtractive?
Yeah, because when I look at the beginning of this budget process, when we put in food services, the bond, we are at 2.1%, correct? So now we're looking at, Mike have an opportunity to say, hey, what do I feel what's best for the Hopkinton School District, playing with about 6, whatever, I don't know what the number is, but my point is I just want to make sure that there's that room for our superintendent to invest into the schools and give us something. That's just, want to make sure that I do understand adding, subtracting, and all that.
And I appreciate the support, and I think I've known you all now long enough to know where you're all coming from. I would also say that when I took the job, I knew it was a multi-year process, right?
Yeah.
But I also said at the very first budget meeting, I'm going to put everything on the table so everyone knows where I'm coming from. Not expecting all of it, but just so you know, as I said, come October of next year, guess what I'm going to be bringing forward? Whatever doesn't go like that. It was just me being transparent so that you know what was going to be coming down the pike. So I do appreciate that, Norm, and I think this is a good plan. So that's something that Michelle and I will work on, and it may be maneuvering other. Like I said, Michelle went on, she did all these steps, and we couldn't keep up. So that's where her and I will spend some more time on, if we do a multi-year food service, what does that look like? That frees stuff up. So.
Okay, perfect.
It was like watching the street guy in New York City moving things around really fast, and you're going, how'd that happen?
And I would say that Michelle always errs on the side of conservative to protect the community, the taxpayers in the district. So when she presents something and is on the side of caution, and that's a benefit, as Jim said, come January, she might say, hey, we have another 45,000, 50,000, what can we do with it? So.
I have nothing more to add to this conversation after all the talking. I mean, I concur. I think going as conservative as possible to start off with on the percentage is where I would want to land based on I think Dulcie did a good job of outlining what our goals are this year. And I also think that even with this 2.5-ish %, or up to 3.25, we're doing some really good things. We're changing some of our budgeting practices in a way that makes our budget more, I can't think of a better name than transparent, but easier to understand.
And I agree, starting on that side, but we do need to communicate that we do have $186,000 come out of ESSER that will be a potential will be an increase next year potentially in this budget. So that's about 20 cents in the tax rate or so, 23 or 24. So
I just want to say yes and no.
Okay, well I have to.
And I don't mean I also want to not have people worried about that, because if ESSER in the jobs, we do their job, so if numeracy and reading is targeted learning loss and that comes down, then that comes out.
Yep, but it's important to discuss it because we are funding the 5th grade position potentially with that, unless you work some magic, with the numbers. Because that's going to be a position that's going to come to this board again to discuss. So that's all. I just wanted to throw it out there.
Sure.
Anything else on the budget? So
I'm going to run with 2.5. Is that all right? Is everyone all right with that?
That's fine. I'm in the
Just start.
I'm in the 2.5 to 3 range.
Yep.
So yeah.
To start. Yep. Okay.
Yeah.
Yep, we're good. Yeah.
A lot of yups. That's great.
Ms. Clark, you all right with that?
Yes, thank you.
All right.
Thanks, Michelle.
We'll meet. Well, you're not done, but I'm going to turn.
No, I know, I'm still here.
Anything else on the budget? We feel good? So, so we'll work.
I'll work with you two on agendas and when it comes out.
And Norm, when's your next budget meeting?
So tomorrow night's our next meeting. Perfect. So we plan to discuss. Mike will be attending it with me. We'll probably bring the agreed contract just so they can see it, and we will discuss that. As of right now, the board's given direction for a 2.5 operating account. We do not have an HEA agreement. That's still negotiations, and just so they can answer some questions that Mike's there, it'll be a quick discussion.
And do you know when our budget materials due to the budget committee?
Great question. Usually wait till right after our meeting.
Yeah.
So have you gotten complaints?
No. I was just going to ask
No,
if you
it's-
could
I
ask
think
them
it's set.
tomorrow.
I think
And
that's
so-
set already, yeah.
Yeah, so I
It
usually,
is set, I just don't know the date.
yeah, so I wait for it to become public here before the budget committee sees it.
No, I totally get it.
Yeah.
I guess what I'm asking is if you figure out when they need it by, then we can back up for when we need to have that final discussion with Mike and Michelle in order to set it in January.
I see
I
what you're saying.
assume it's going to be in January, but it'll be,
Yeah.
whatever that date is, it would be good to know so we make sure our meeting's aligned with
Correct.
getting them the information they
I
need.
feel like Dulcie might know someone to get that answer.
I think so. Or you guys can find out tomorrow.
Yeah, because I think the town, based on this discussion, since we're not going to set ours till January, I think the town's going to be going first anyway.
That's what I assume.
That's what I assume.
Okay.
Perfect. All right, thanks all. So we're going to move on to the consent agenda. I'm going to turn it over to Mike.
Okay, personnel report. So we did have, there was a last minute ad here. It made it to the board notes. It didn't make it to this document. So just an FYI. Okay. So looking to recommend new hire Emily Barnum as an instructional assistant. And then we have been fortunate enough to find someone now for the middle high school in regards to tutoring. That was the last minute ad. So Lauren Prosek, sound right? Okay. Also on that list is our Schedule B winter coaches. I'm not going to go down the list. You can see who is there. I will make another sales pitch as I did in the fall. If anyone is interested in middle school girls basketball, as well as middle school Nordic. I will point out skate because of how much he does for us. I'll call him. As you can see, it's to be determined essentially. So if you're interested in any type of basketball, that would fluctuate where skate might land. So just for that to point out. So really, any questions on personnel?
Position 10.
No?
A little bit of an issue with position 10.
Okay.
What's that, Norm?
He was being funny.
Just position 10. Position 10.
So, moving on to the report, I'm happy to say that Parent Square has been officially launched. I would say I compliment Mr. Stone on the implementation. It did not marry well with some of our internal stuff. So it took some repeated programming and multiple phone calls with Parent Square. I'm going to encourage that any parent that hasn't got the email maybe or has not officially clicked on it to please take the time to click on it. We're going to send multiple notifications, but that will be our communication process now. We've been soft launching it through the middle high school. Principals have been soft launching it. We want to make sure that everyone's connected before we go full throttle on all of that. So if you have not essentially signed up, please make sure, and we'll move from there. The second exciting part is social media's launched. So it's all been scrubbed and launched. You're going to see some notifications out from us to follow us on Instagram, Twitter, and Facebook. We're going to be using those for different things, telling our story within the building. I have a feeling you know what your question is, but go ahead.
No, well, it's just like I'm on all the listservs for all the schools, because I think it's great. Will the principals still utilize any of those listservs, or will it be on Parent Square? And if so, can community members sign up for general updates?
So we're trying to work through that.
Okay.
All right. So Parent Square is tied to our student information system.
Yeah.
So it's tied to all enrolled students. So that's how that's connected. So an emergency at the middle high school, we shoot a text now saying, we'll use stay put as an example. So parents will get a stay puts in place because of the medical. We'll update you in a little bit. So a little more direct communication. In regards to essentially community updates, it's probably going to lend towards the skim and that, and being able to locate that directly.
Yeah.
So those listservs will go away. So we have to connect with non-parents, guardians, to see how we can connect them to the news. Right?
Yeah, and then the only one, the individual schools might be sort of an outlier, but there's a lot of non-parents who follow, I think, sports. Yeah. And so just for Dan, I think that's probably the biggest. Yep. Who may be like me and not be on social media.
Yeah, and we want to also, we don't want to be strictly social media. I'm
No,
on,
no,
and that's
totally,
where I knew
totally,
your, I
yeah,
thought your question
yeah,
would go.
yeah.
We have to find a lane for non-social people, media.
Yeah.
And I didn't mean it that way. But we have to find that audience. So
Yes.
whether it is a Parent Square, I don't want to go down the, we'll figure that out.
Okay, I think it's a good thing.
Yeah.
I have one question.
Yeah.
And it might be more of a question for Matt. Is Parent Square good with Yahoo Mail and AOL Mail? You know, there are some mail systems that just didn't like us.
Yes, there are no issues, plus you can actually sign up just with a cell phone number if you want, so you get it all by text, or if you prefer by email digest. We do encourage people to put their cell phone in because there are certain urgent alerts that override your normal preferences and say, hey, we just lost power at Airmark, can you come pick up your kid? That's not something that you want to wait until 6 o'clock at night to get your normal digest time.
Okay, cool, thank you. Great.
So I'm gonna kind of go off Max and give you a little bit of a sports update for the fall, now that our seasons have wrapped up. And I said it at the whole district meeting on Monday. I'm not used to all the winning. It's definitely been different for me.
You are a Steelers fan.
Oh, we do have the most. Never mind. I'm not gonna. But being a part of this is different. And what I want to point out is more specifically, we had 59 7th and 8th grade students participate in athletics and 151 at the high school. So that is nearly 50% of our student body is participating in a fall sport. That's just fall. So when I talk about policing themselves, or they know the ramifications of what they do, but then they also have great success. So on that note, girls field hockey, girls soccer, and girls cross country all went an entire season without a loss. Again, not normal for me. So congratulations to the Lady Hawks for sure. All three were also state champions. I was lucky enough to go to the field hockey game, which was Ms. Condon, who's in my office now. I don't think I had a choice. But I want to say things, I said it repeatedly, it's not normal, right? So the student body there was unbelievable, and it was all positive, right? It wasn't harassing the other team or whatever. They were there for their team, their students, the camaraderie. The amount of parents there, I heard neighbors were there. My kids got a new example of field hockey, so it was a great experience. So compliment to our non-students, our non-athletes that were there supporting our kids. So that was great. On top of that, the JV soccer team also went undefeated. And then JV team has had a good season as well. So I don't think you're going to see losing happen anytime soon. Boys program did a great job. Varsity entered as a second seed. Obviously, kind of a heartbreaking upset, which I heard about all the next day in the office. Same thing. Another cool thing is golf petitioned up this year. So they played up and finished 4th for the first time after petitioning up. Boys cross country killed it. 2 runners placed at the Meet of Champions, which is a huge deal. If you don't know running, look it up. Do yourself a favor and take a look at those articles. That's a really big deal. Football had a challenging year, but we had football, right? So that's a good thing. Last is girls soccer. Field hockey and cross country. Oh, this is just some notes about how the student athletes coming up. We have a large senior class. That's the way to say it. Okay, and those student athletes will be moving on. We have a great farm system coming up. That's the best way to say it. So I am proud to be a Hawk. It is so much easier to go to my meetings and wear my gear and fly the flag pretty high. It's been fun. I've been able to rub it in people's faces. So, wow, it's worked. And actually, the middle school soccer team beat Hampstead, upset Hampstead. So that was a good phone call the next day as well to see how they were doing. That's all. Nothing else. So, that's a fall sports update. Also, just a congratulations from my office. Chief of Corps retired. I know I only knew him for a short time, and he had an impact on me really quickly in the work he's done in this town. But also, congratulations to the new chief Hennessy, who's now in my seat. Right, we're both starting at the same time, so we're going to be reaching out to set up that meeting and start that process. But I know Hopkinton's in good hands from everything that I've heard. So, congratulations there. School calendar will be moving forward to you guys in the next couple meetings. We've developed it as an administrative team. It's going to go to both memberships for review, and then we'll be presenting it to you hopefully for the December date. Just an idea and a heads up. Strategic plan began today, that process. We met with our consultants in the steering committee. We want to thank all the volunteers for the steering committee. We have some work ahead, right? So when you start from nothing, it's a little bit of a challenge. So we're going to set some goals and set some objectives and kind of try and have that done prior to the school meeting, so that's part of that process. But it's officially underway, which is exciting to have that completed. Last, I'm not sure how many people are aware, but there's going to be a new rule in place that allows schools. I'll say that I was a part of a district that did blizzard bags. I don't like using the term blizzard bags because that's initially how it was created. Blizzard bags have come a long way from hard copies in hands to go home. But the state is going to now, we had to apply, we had to present information, we had to do all these things in order for it to happen. But the state's going to essentially allow districts now to hold remote instruction days on inclement weather or disaster or that power outage in schools type of stuff. So we're forming building level committees at this time to begin that process of what it may look like. But it looks as though I've seen the success of it in my district. We've used it repeatedly up to 5 days. So I just wanted the community to hear that message because that work is going to begin, and we'll bring it back here to present updates and all that type of stuff. So that's just something we're working on. So
that's really great news, because those disruptions and what happens at the end of the year between when exams, it's just going to make the whole end of the year so much smoother when it's far more predictable.
Yeah, there's people on that other side that said, I want to reiterate, snow days are not going away. All right, the traditional days will still be in existence, but it allows us to not add 3, 4, 5. We used all 5 days last year in Hampstead, and when you talk about, I'm a huge advocate. I'd rather have them for a half day online in the winter than a full day in June 23rd. As a classroom teacher, I just had far more success continuing my academics at that time. So we're in the process of working on that, but it's something to look forward to. We have a lot of things in motion, but that's one of the things I wanted to move forward. That's it. That's it for me. Now it's on to Michelle. Sorry. I keep forgetting. You're not to my left. You're in front of me.
I have one item.
All right.
So the baseball team did work the New England half marathon, and so they got a $500 check. So that is for you guys for approval, and that goes in their student activity account for their items that they purchased directly from there that are not district fund obligated.
Nice. Thank you.
I can confirm that they were there.
You see me?
Huh?
You see me?
I did. You were at the end of.
Yeah.
Yeah, I saw you. Yeah.
All right. Is there anything else on the consent agenda?
There is nothing else.
All right. So is there a motion to approve the consent agenda as presented?
So moved.
Second.
All right. Any discussion? All those in favor?
Aye.
Anybody opposed? Ayes have it. I did screw up at the beginning of the meeting, which never happens. I forgot to include the joint school district Board of Selectmen meeting minutes, and so I would ask if there's a motion to approve the joint meeting minutes from October the 26th of the
Yes.
yes
Yeah.
of the Hopkinton School Board and Hopkinton Select Board.
So moved.
Second.
Perfect. Any discussion on those minutes? Seeing none, all in favor?
Aye.
Aye.
Anybody opposed?
Negative.
Sorry about that. Was there a sign-in sheet for public comment?
I'll grab it.
Thank you.
Can I also do a 60 update in regards to updates?
Well, yeah, you're supposed to do updates first? No.
No, I'm following.
After.
Oh, you're
Is
right.
that okay after? You want to do
Yeah,
it?
no, yeah, I want to go with all the committees. I just,
Okay, yeah.
You know, CIP committee.
That's huge.
You said it.
We'll get to that. All right, so public comment. Sabrina, as already know, is going to call on her. It's amazing. Thank you.
So I had a clarifying, Sabrina Dunlap, clarifying question. I thought I heard Andrea ask, if things are like they are now in January, what will we do? And Dulcie said masks would be optional. Was I correct in hearing that or no?
No, so my question was if the specific CDC guidelines and AAP guidelines are as they are currently in January, then what would we do? And then Dulcie gave a whole bunch of qualifying stuff.
So because we're in high transmission now, so I assume you guys would be looking at lower transmission as one of the factors.
Yeah, one of the things that's in there is, I think that I put forth, like, so CDC and, can I respond or not respond?
You can, respond.
Yeah.
Yeah.
CDC, New Hampshire have different thresholds, and they have completely different sets of standards and numbers for what they use as their distinctions for substantial, high, very high, severe. The number that I sort of put forth was sort of 50 per 100,000.
Okay.
That's subject to discussion. I think we're going to be looking at where we are at that first meeting, January 11th, whatever it is. Yep. Yes.
And we can, I'm sorry, and we can put the presentation that Dulcie and Norm worked on the district website, and then we'll revisit it on January 11th.
Yep.
And also, just Andrea, I think you made a comment about teachers having like low case rates, and hopefully that will translate to the student population. And I totally agree and hope that's the case, but I was just thinking that the teachers have also been masked the whole time, and I think that most of them are vaccinated, and my fear is that based on national polling, we're not going to see that type of vaccination rate. I heard it was a third are doing it immediately, a third are waiting, and a third will never vaccinate. So I just hope you'll keep, well, and I think adults are much better at not breathing in each other's faces, unlike little kids. So I just hope you'll keep those factors in mind. It's a wonderful thing, the vaccine's available. I think there's a lot of caveats around it too, so I hope you'll keep that in mind. Thank you, guys.
Thank you.
Thank you.
Next, Rita Blanchard.
I didn't know I was going to speak earlier. And Rob, I'd just like to apologize for calling out something you said several meetings ago.
Thank you.
I was listening to the meeting before I left to drive to come here because I had a baby and other stuff going on. So I do want to apologize. I didn't realize it was just for tonight, and I did not hear what you said. So that's all.
Thank you.
Thank you, Rita. Lauren? Surprise.
So quick. Lauren Clement, 86 Maple Street. I wanted to touch on a couple things. I'll try to keep it moving along. I guess I'm going to back up. Last meeting, I spoke to the 5-year progress report that you guys have online. Superintendent wasn't here. I don't know if he listened to public comment or not, but I touched on a couple things. One is a parent advisory committee that's in the report, and it says that it hasn't been established yet, and I spoke that I would be interested in joining that. And I don't know if you've looked at that or if your previous experiences there was an advisory committee. But I find from speaking to others in the community, there's a lot of what community members feel is lack of communication, or if you have a question, we may ask it, it never gets answered. That sort of thing. I mean, I've got a whole list, and I don't want to waste 3 minutes on that, but maybe we could talk about
Sure,
that.
absolutely.
Secondly, something that was in here, and I want to bring it up again in case you didn't hear my public comment, is under, there's a request for a social worker, And it's pretty much outlined in the report that there's a high demand on the current guidance counselors. And I think in the climate, mass, vaccine, there's a lot of, I know in my household with kids, concerned about catching it, concerned about death, concerned about, and I can see a ramp up from the stress level of my kids. They're not just kids like they used to be. There's a lot going on, and I have a lot of concerns about mental health. It was brought up with masking, without masking, all of it. We all know it's there. It hits you from every angle. It doesn't matter whether there's peers here or there. So it's got to impact the kids. And I think that it bothers me that that social worker that's in your 5-year plan wasn't included in your all-in budget. And I know, and which moves me over to what Jim just said about the budget. When and where do you receive community input on the budget? I'm curious, when does the community input on this budget? When do we get a chance to hash this out? And again, it goes back to my PAC. I'd like to take community input PAC and bring it to you. And I've been receiving all sorts of input since I start putting myself on different social media outlets, people bringing me questions, comments, stuff that I've looked at the guidelines of what we're supposed to say here. I haven't done this much. I've only been doing it for a few months, but there are guidelines, and I think those could be updated a little bit. There's some confusion. I have questions about it, but I don't know who to ask. So that's another thing. So, and as what I've been doing the last couple of weeks is trying to review our website. I find it very challenging to find out how to make apples and oranges out of it. I looked at the SAU 24 report, school report. It's got all the teachers listed. It's got the principals. It's got their salaries. So it's not too hard to find 5th grade teachers and how many we have and try to compare. Go into ours, not so hot. Go on the website. The principal, Kelly's got a little description and a blurb about what he's done, but then you pick a science teacher and it says Joe Schmo science teacher, and that's all. Why is there not more information? Like, they've been here 10 years. They've been, you know, let's put a little more into it. It's really challenging to figure out who we have working in our schools and be like, do we need a 4th grade, 5th grade teacher? I asked about reports, and Andrea said go into the budget, and I struggled with Michelle's reports. I don't know if I don't have the correct software, but I couldn't pull information from there. But while I was pulling information, I went into facilities, and on facilities, it shows that we have a facilities director listed on our town website. And I suggested, because I am a facilities guy, why don't we instead promote our highest up facilities person, and then we need other custodians, bring someone under. Why do we have a facilities director listed on our website when we're looking to hire a facilities director? Again, more questions that I have that I don't know if this is the appropriate place, but it'd be nice to have a pool of people, concerned parents, a diverse group, not just one-sided, to speak about masking, sports, curriculum, all of it. And I'm willing to do this and hoping to get some response. But I think most people find they come up here, publicly speak for their 3 minutes, never get a reply, and get discouraged. But as a new superintendent, I'm asking you to open that line of communication. There's a lot of discontent there. Last comment on your budget at 3.5%. I think people are going to be voting with their pocketbooks this year, so it's important to get the most important things in there. If the budget gets denied, where does that leave us? And again, this is part of the communication between what you guys, all this energy you're investing, and how the community's take is on it. So I think I can bridge some of that. Anyhow, that's my comment.
Thank you. Just to answer your question, so there's 5 board members up here. You're more than free to contact any of us if you have questions, and we'll do our best to answer them for you. This is public comment, not public question and answer, so it is hard during a meeting. So I guess my best advice to you is to reach out to a board member. if you have questions about budget process, we have a budget committee as well that are elected officials that you could reach out to. But that's why we're here. That's why we're here. So definitely feel free to reach out. Thanks. Tricia Lambert, I already knew I was going to call on her. Look at that.
Tricia Lambert, 305 Galloping Hill Road. I'm not going to talk about masks, but I don't know that you're going to like me talking about this either. But just to keep in mind about COVID, it's now 99.988% recoverable, which has gone up fairly quickly in the sense of that more than survivable. In fact, many people are simply getting cold or maybe no symptoms at all. I've been listening to your pool testing and your decisions, and I tried to give you a chance to see where you're going to go with that. And well, you went full in, and I'll give Andrea a little bit of kudos. Is she actually asked the group to question about the test and how they were going to do it and which one, and I appreciate that because that's the information that I think parents want. So in the past week, we've confirmed that the test you are in fact giving through your nurse's office has ethylene oxide on the swab, which is not a swab. It is actually an emergency use authorization test. And what that means is that it's not enough to say, dear parent, would you like me to test your child? It means you must have consent, informed consent, which means you must tell them the risks for that child or the person who's taking it. So if you know anything about ethylene oxide, and I know that I emailed, there's a few people here that were not on the emails last spring because I did a lot of research on this particular test, which some of them were in fact recalled, class 1 recalled. If you go to an EPA website or even CDC, the EPA has concluded that ethylene oxide is carcinogenic to humans by the inhalation route of exposure. Evidence in humans indicates that exposure to ethylene oxide increases the risk of lipoid cancer and in females breast cancer. So when you're talking about risk and what you're doing and whether you're going to get COVID and the child's going to get sick, you might want to be looking about the risk and what your insurance is going to cover because you all proved that pool testing. And I heard a lot about following CDC and this guidance and what do we do? Do we just simply follow that? It's your job to find out the information, and if you're not sure, you shouldn't be doing it. So I encourage you greatly before you continue to touch children or anybody that you at least give them informed consent of exactly what the risks are. It's cancer. And that's short and long term. And they will, and I'm saying this here so that everybody understands it, that you know. Thank you.
Thank you. So no one else for public comment, so I'll close public comment and we'll move on to my favorite category of other business, old business, and committee updates. Dulce, I'm going to start with you. CIP update.
Yeah, so CIP update is we, with Michelle's support, been working on getting sort of more insight into what numbers are going to look like. There will be a body of work that's going to happen around looking again at our 3-year plan, and then also looking at what's happening coming out of the building committee and sort of how we're going to think about that in conjunction with CIP. So I just wanted to put that into everybody's brains. That'll probably happen over the course of the next couple months. So keep it clocking through there. That's it.
Nice, thank you.
You said it.
Norm, building committee.
Sure. Before I start, I wanted to thank Mike for having the Q&A for pool testing that we had a couple days ago. So I just wanted to say that publicly. I had a lot of people reach out to me saying
We sent that video home too.
Yeah. So I just want to let a lot of people reached out, and a lot of the good questions were asked. So just thank you for moderating that and bringing that to the community. So the building project. I'm pleased to say we are done. That what we're working on right now. I know.
Wait, are we actually done?
We're working on a punch list. So the punch list. So the punch list. Mike, is that safe? Michelle, Mike, is that safe to say? We're working on the punch list stuff a little bit in the lab, but
yes, I would say we're down to an actual punch list.
Yeah,
And the labs are open?
They've been open.
Yep.
Amazing.
Yeah.
So, as you know, we have come to this board numerous times since Jim and I, we started this whole thing with numerous adults for this project, from fire suppression, glazed windows, all these things that exceeded the promise to the taxpayers on this bond. So about 2 weeks ago, last week, we met as a building committee, and we received news from BPS that we will be receiving $225,000 back from the project, which is great news. This number might increase a little bit. We're going to get a firm number on November 22nd from BPS, where he basically is able to close the books out with Michelle, and that'll be essentially the end of the building project. The group will meet, discuss. We gave direction to him or got him some quotes that we're looking for, because some of the quotes we received are out of date. Rob was there. Rob's made some recommendations, some thoughts, which I'm sure I'm happy to have him bring to the board. But there's still some work of a recommendation from us that we will bring. There's goals of things that we have excluded from the project that maybe we wanted to put back in, that Jay's working on. We want to follow the methodology to a degree to help maybe alleviate CIP, working with you guys on that for future budgeting process. It's so important that we use this money to help improve our schools continuously, and really bring a solid recommendation to you guys. So it's great news to announce that we will be receiving $225,000. It's potentially that we could receive maybe $50,000 more to that, but not until November 22nd will we have a solid number. We will bring the number back to you guys. We don't have to spend it like that. Just want to be clear on that. We have a window of being able to use it, but we have the resources with BPS, so that's very important. So Mike is working with his team, working with Michelle. He's going to work with the building committee. He's working with Jay, and we will bring something to you guys.
Congratulations. That's great.
Thank you.
Awesome.
Yeah.
Great number to have.
Did you want to say anything else? I mean,
I spoke very much in favor of exploring the possibilities of better climate control at the 4th and 5th floors of the middle high school, so, if feasible.
And I guess, like I said, it'll be exciting to see what it is in our next meeting. And then just for tomorrow night, I am meeting with the budget committee. I will bring financials. Mike's going to join me, just to unpack it a little bit more. Like I said, they were really receptive to being part of this process, and this is still part of the process where we have agreed to 2.5% right now as a baseline. So I think Mike going there to answer some questions that maybe I wasn't able to answer in the beginning, I think holds a lot of value. So I appreciate you joining me for a little bit tomorrow.
Can't wait. It'll be great.
Yeah. That's it.
Anything else? We heard from policy already. You guys
Yeah,
are
I
rocking it.
have no policy and no curriculum
And
updates.
Mike's given the strategic planning committee update, so that's great. Anything else?
Financia?
Finance?
I think I gave the finance when we talked about the budget.
You did it in a
Wait, I
one-pager,
still
everybody.
haven't.
One-pager. All right. Anything else? Any other old business? Seeing none, we do have a request for a non-public. And so to ask if there's a motion to go into non-public under RSA 91A, Roman 2A for personnel.
Second.
Any discussion?
I did add one for safety.
Oh, did you need that one?
Yes.
Okay, so it would be A for personnel and C for reputation.
So moved, the amended.
Second, the amendment.
Perfect. So it's a roll call. Rob?
Yes.
Norm Gupel, yes.
Yes. Yes.
And Jim is yes. So we're going to non-public.
Good luck tomorrow.
Thank you.
Good night, everyone. Bye, Michelle.